Recording in progress.
Good morning. Thank you for joining us today. We will go ahead and get started. I'm going to call the meeting to order at 9:02 a.m. And let's do a round of introductions. I'm Nancy Wise, Chair.
Pat Malone, Vice Chair.
Zano Giroux, Commissioner.
Joe Kirby, County Administrator. Vance Cronin, County Council.
And we will go to the audience for introductions and we'll go online.
Hi, I'm Lauren, the health administrator.
Gotta go, just here. Corey Rogan, County Public Information Officer.
Amanda Hughes, Administrative Assistant.
Erica Milo, Board Recorder.
All right, and if you are online, feel free to introduce yourself.
Sammy Imperati, facilitator.
Lynn McKee, Director of Benton County Natural Areas, Parks and Events.
Good morning, Darren Nichols, Community Development Director.
Suzanne Hoffman, Health Department Director.
Matt Weatherall, Juvenile Department Director.
All right, is there anyone else online who would like to introduce themselves?
Molly Murphy, Benton County Veteran Service Officer.
All right, welcome everyone. We will go to announcements. Are there any announcements? Hearing none. We will review and approve the agenda and changes to the agenda. Hearing none. That brings us to comments from the public. If you would like to make a public comment, say you have up to 3 minutes. And I will check with the room first and then go online. Is there anyone in the room who would like to provide a public comment? There is none. Anyone online who would like to provide a public comment? I have Debbie Palmer. Debbie, go ahead and unmute yourself. And you can have up to 3 minutes.
Oops. There. Okay. Sorry, I have a hard time hearing you in the room, but okay. Good morning, commissioners. As you know, we face a climate crisis, and I know that the climate crisis is a top concern of yours. So what can we do about it here in Benton County? I'm going to share a couple of data points, then connect the dots for you. Item 1, from the World Meteorological Organization's latest report as printed in last week's October 27 Gazette Times. The 3 main greenhouse gases, carbon dioxide, methane, and nitrous oxide, hit record high levels last year. Of those 3, the biggest jump was in methane, whose concentrations in the air had the biggest year-on-year increase since regular measurements began 4 decades ago. Item 2, from a 2010 report prepared by the Sierra Club Landfill Gas to Energy Task Force, assembled to evaluate whether landfill gas to energy facilities decrease or increase net greenhouse gas emissions. The group unanimously concluded that reliance on landfill gas to generate electricity results in increases in net greenhouse gas emissions. They went on to report that this is clearly the case when considering the fate of new wastes that could be diverted to waste management facilities more appropriate than landfills, and that it almost certainly is the case for wastes already buried in landfills that collect gas, landfill gas, and flare it. Item 3, from op-ed writer John Crisp in his October 19 column in the Gazette Times with regards to how we deal with climate change. What he said was, the most alarming warnings about a warming world often end with the optimistic note that it's not too late if we act now. Yet we do nearly nothing as things continue to worsen. I'm going to read that again. The most alarming warnings about a warming world often end with the optimistic note that it's not too late if we act now, yet we do nothing as things continue to worsen. Well, I'm telling you right now, there is something you can do. You can stop approving expansions of the Coffin Butte landfill, that accidentally sited landfill I spoke to you about 2 weeks ago. I am begging you to open your eyes and ears to the mounting data that landfills in a wet environment are a climate hazard. There are solutions other than wet landfilling for dealing with the region's garbage. I'm going to end my comment with a point-blank question for all three of you. Commissioner Malone, Commissioner Wise, Commissioner Ojero, is the intended purpose of this trash talk work group you convened, that bridge you're asking for, to garner consensus for a landfill expansion? Or are you genuinely open to alternatives? I will take my answer offline.
Thank you, Debbie. Is there anyone else who'd like to provide a public comment today? Hearing none, we will move on. First item in our work session is a COVID update from the Park Operations Center, April Holland. Welcome.
I have an interesting COVID update for you today in that we're still in a really relatively quiet place right now. And we still have predictions that we will see increases throughout the rest of the fall and winter. After increasing slightly at the beginning of September, both statewide and in Benton County, overall reported cases of COVID-19 have continued to decline a bit. And as we move in earnest into fall and winter, we do expect increases in both COVID-19 and other respiratory diseases. Infections, excuse me. And while a mix of new Omicron subvariants and standard waning of immunity are expected to generate a fall and winter increase in infections, the effect may be mitigated by the new bivalent booster. It's yet to be determined exactly what that is going to look like. So when the details of vaccine effectiveness become more clear, modeling by OHSU and others will be adjusted. So to the data. The CDC reported case rate is 59 per 100,000 residents, down from 112 from when we last provided an update 2 weeks ago. And locally, our testing positivity rate is just under 5%. When we see that positivity rate creep up to around 10% or higher, it can indicate a lot of transmission and the need for more testing. Hospitalizations have been mostly steady, but have decreased somewhat in recent weeks. Total hospitalized patients in Oregon as of October 26 was 238, down 10 people from October 12th. And of course, hospitalizations remain much lower than that last peak we had of 464 people across Oregon in mid-July. In Region 2, 29 people were hospitalized as of October 26th. In the month of October, across the month, regional hospitalizations ranged anywhere from 13 in a day up to 38 in a day, with an average of 29. The latest CDC data reflect 4.9 COVID admissions per 100,000 population in our area. This is up from a low level of 2.2 2 weeks ago. There is a lot of variation overall. However, the numbers with that big fluctuation, that huge range from 13 to 38 and an average of 29 a day gives us a better idea of where we are. Thankfully, things have remained relatively calm in terms of COVID-19 so far this autumn, but modeling as well as experiences on the East Coast and beyond predict that we're likely to experience increasing cases in the next few weeks, followed by an increase in hospitalizations that may peak around mid-December with a maximum number of 630 hospitalized. This is according to the OHSU modeling. we are expecting an updated OHSU forecast by the end of this week, and these figures may be adjusted, and we'll keep you updated. And, again, as more people gather indoors and we move in earnest into the winter season, we do expect that COVID-19 is going to increase in terms of transmission. And across the US, while case rates and hospitalizations are flat on the whole, there are some areas of concern. And the overall test positivity rate has started to climb for the US as a whole, possibly indicating some coming increases in hospitalizations as they follow cases. Many of our neighbors across the Atlantic are experiencing increases in hospitalized patients for COVID-19. And we know that trends in Europe have made their way to the US several times previously in the pandemic. So we should remain vigilant and prepare for increased levels of transmission. And looking at wastewater surveillance data, through October 26th, our most recent data, it's mostly unchanged. So no big fluctuations up or down. But Oregon, as I mentioned 2 weeks ago, it has halted its downward trend in average wastewater levels that we started seeing in July. COVID vaccination continues to be widely available. Pharmacies and providers' offices and beyond. And we will host community events in mid-November at the Benton County Fairgrounds, the OSU Memorial Union, and at Lincoln Elementary, Clemens Elementary in Philomath, and the Boys and Girls Club of Corvallis. And finally, this update will once again end with a request for influenza vaccination. The annual flu vaccine is the best way to protect against flu. Vaccination helps prevent infection and can also prevent serious outcomes in people who get vaccinated but still get sick with flu. And CDC and Benton County Public Health recommend that everyone 6 months and older get an annual flu vaccination. Flu is off to a strong start this year. So if you are someone who usually holds to a later schedule and gets your flu shot around Thanksgiving or even New Year's, please reconsider your timing this year. If you're on the fence about a flu shot, please know that this year, unlike the recent few, influenza is likely to have a strong showing. Nationally, the hospitalization rate in the CDC flu reporting system is higher than the rate observed this time of year during previous seasons back to 2010, 2011 season. Flu activity continues to increase across the country. In the southeast and south central regions of the US is where the highest level of activity is currently occurring. And then overall, if viruses could be happy, many would be this respiratory season. We're experiencing an active fall and winter with influenza, RSV, which is respiratory syncytial virus, and other common viruses, such as those that cause hand, foot, and mouth disease. To help reduce transmission, please wash your hands with soap and water and avoid touching your face. Stay home when ill, cover those coughs and sneezes, and consider pulling out your stash of fashionable and very effective masks when traveling or in a crowd. And again, our healthcare systems remain strained from hospitals to long-term care facilities and beyond. So we encourage all to avoid further strain and help protect yourselves from COVID-19, influenza, and other respiratory illnesses this season. Thanks.
On the happy to hear about the continuing vaccination clinics. I was curious, is most of the vaccinations in boosters, or are there still people coming in for the first dose?
Certainly most are boosters. However, we do continue to make available and provide first and second doses for people every time we host clinics. So we'll continue to leave space for that and encourage it and have those conversations with people as they come through.
Great. And you mentioned modeling shows COVID peak in mid-December, which seems kind of early, thinking of flu season and winter. Are there predictions that after mid-December, do we get a plateau, or is it maybe a nice spiky peak that drops off, or?
The unicorn horn of last year's Omicron wave, it was a big relief to come down pretty sharply from those high cases. It's really tough to say, partly because we have a sort of a stew of COVID-19 Omicron subvariants out there right now, and none of them at this time are really dominating the scene. So without something identified that is clearly going to kind of take the stage and cause major disruption, I believe that modelers are having a more difficult time to say, exactly what the future is going to look like. And because it is somewhat of a stew, we're seeing different things happening in different places. So a bit trickier to model specific to a given region, which is part of why I'm and many others are really interested in seeing the updated modeling from OHSU.
Okay, thank you.
Thank you.
Other comments or questions? All right, thank you, April. And it looks like you are back with us for our next agenda topic, which is the 2023 fee schedule for environmental health. And with you, Scott Kruger. Welcome. And please correct me if I said your name wrong.
Thank you. Okay, so switching gears. Thank you. So we're going to switch gears a little bit. Our environmental health program is in a transition right now. Our longstanding EH manager retired at the end of June, and it's time for one of our annual standing items with the board, and that is the updating of environmental health fees. I have with me Scott Kruger, who is the expert in the room. I took the liberty of crunching all the numbers and bringing them to you today, your technical questions and historical context. I would graciously, I would hope that Scott can fill in the gaps, and he's doing a great job as our interim EH manager as we continue our search here. So without further ado, we're going to pull up a slideshow for everyone here. And there on the front page, we have beautiful Alsea Falls. So every year, environmental health program, we review projected expenses for the coming year and propose environmental health licensing fees for your approval. And as you know, the fees cover a wide range of activities, many of which are listed on this slide. Oh, thank you. I do want to say, as we move through these slides, adjustments are not across the board. So you'll hear me say fees on average will increase X%. However, there are special fee adjustments for certain circumstances, generally applied to reduce burden and to increase compliance. And I'd be glad, Scott and I would be glad to talk about some of those as we move forward. So a little bit of recent history for you first. No fee adjustments were made to environmental health fees in 2022. In 2021, fees increased 3%. However, due to the pandemic, a 50% credit on the 2020 fees was applied to the 2021 license fees. And in 2020, no fee adjustments were made. And I wanted to give you a little more context here. So there have been, it has been the norm to have fee adjustments prior to the disruption of the pandemic. And you can see here, they range from 3 to 5%. And with some exceptions noted here on the slide for certain program areas not having increases. So what we do, what environmental health does, and what I've done for the first time with Scott's help, was to review the environmental health budget to base a proposed fees on. You can see here, this is straight out of the approved budget, which is what is used to calculate proposed fees. There's some changes over fiscal year over fiscal year, with an overall increase in budget estimated at 3.6%. Okay, this next slide, I'm just going to pre-warn you, there's a lot of stuff on it. Environmental health calculates an hourly rate on which the field hours are calculated to help get to the overall cost of providing service. So here you can see the total numbers of worked hours in a year with a bunch of subtractions for various things to finally get to the field hours per registered environmental health specialist. And that at the very bottom, it's a little bit cut off, is 1,251 field hours per staff, or 5,004 hours in total with our 4 RHSs. Now we're going to get into how we calculate the hourly rate. If we looked to fees alone to cover all environmental health expenses, we'd simply divide field work hours by our total expenses. However, using the full cost recovery method, what you see here would equate to an hourly rate of $242.27, which would in effect increase the environmental health licensing fees on average from their current level by 17%. There's also legal limitations that we must adhere to. So we're only allowed to pass on 15% of administrative costs onto fees for OER. And so those indirect costs must be capped at that 15%. And this is nothing new. Sorry for the formatting of this slide. I wish you could see the whole thing. So each year, environmental health undertakes an adjustment for those indirect costs. And if this clicker works, you can see here the yellow line shows the overall administrative costs at 29%. However, that must be revised to 15% to stay within the requirements of the OER. So at the bottom of the slide, the final calculation under 5,004, which unfortunately isn't visible due to that taskbar, shows that the hourly rate for full cost recovery, incorporating that 15% cap, is $215 per hour. It'll be summarized here on this one. So with county general fund, picking up the excess of administrative costs beyond 15%, 89% of full costs are still covered with fees. This corresponds to a fee increase on average of 5%. And if the board approves this increase of 5%, this would actually correspond to a general fund contribution decrease from $140,708 to $134,144. I have a bit more. One thing that's a bit different this year is we have 3 scenarios for you. You're the decision makers, and coming into this process and helping to calculate these fees it's a very straightforward formulaic process. So the 5% increase on average of fees would correspond to an hourly rate for field work of $215 per hour, would recover 89% of costs, would require the general fund contribution seen there, and would be a change from 5% from last year. Because the formulaic way of going about this is not always what staff has recommended, I put together 2 other scenarios here for your decision making, for your consideration. Now, to adjust fees by 3%, taking us to an hourly rate of $212 per hour for field work, still getting 88% recovery from fees, would require a $150,000 general fund contribution, a slight increase from last year's contribution of $140,708. The final option does not seem sustainable, or like the option that the board may want to go with. The hourly rate would change to $205 per hour. Recovery would be down to 85%, and that contribution would be up by 31% from the previous fiscal year. So I hope that you're not too surprised from the bit of a diversion from the usual process. However, this is the first time that I've worked on bringing environmental health licensing fees to the board, and wanted to make sure that you had as much information as possible. So this is the end of what I have. I do have a couple of figures here just to demonstrate, to give you an example of what a 5% increase would feel like. So a restaurant with seating for 50 to 150 would see their license fee increase from $943 to $989. Bed and breakfast with capacity for 11 to 25 folks would see fees go from $410 to $430. Just a couple examples for you. And Scott has a lot more that he could share. And I don't know if you have something you'd like to say, or if you'd like to just respond to questions from the board.
I don't have anything else to say, but if you have questions, I'll do my best to respond.
Thank you. Comments or questions?
I remember the discussions during the pandemic, and restaurants are closed or very limited. And I think made sense to try to do what we could to take it easy on our clients. And I remember something about not getting all the inspections done, and so I think it's accurate to say we went through a turbulent time, and it made sense to. I mean, I'm looking at I had it a minute ago. The history, which I appreciate, kind of adjusting the fees annually, and so we don't get behind or further behind. I guess from the front lines, what are our restaurants looking like at this point as far as business health?
That's a great question. Our community is certainly saturated with quite a diversity of restaurants. I think it would be pretty easy to see the plethora of coffee shops and pizza restaurants, probably due to it being college town, and those are probably staple foods. At last count, we just went through this exercise a couple of days ago, and I want to say to date, we're down 6 restaurants this year that completely went out of business.
Yeah.
Um,
Out of how many?
400, well, we have 450 facilities that we issue license to, and of that, I want to say 250 of those are food service facilities.
Okay, thanks.
Yeah.
Other comments or questions?
I had the same question. Bill Eminger always came to us with a little bit of a sense of how things were going out there. So I think that it's still rough, is what it sounds like. And while it would be nice to get to a maximum cost recovery, the dollar difference in terms of hit to the general fund just isn't that big. So I would think we have a decision to make, 3% to 5%. And I would happily support a 3% increase on average.
And I think we're talking about bringing this back to the November 29th meeting.
I think the decision was today, but 29th was to sign the order.
Okay, perfect. So, other comments or questions? I am concur with Commissioner Ozero about the 5%.
I think I said 3%.
Oh,
I'm
I'm on mute also, I realized. I had said 3% would be fine by me rather than 5%, but as you said, we have time to think about it.
do you prefer a decision today of 3% versus 5%?
Commissioner,
That
if it were possible, the staff in the environmental health program really should, it would be great if they could get moving on all of the changes needed to
Okay.
implement those January 1st. Yeah.
Thank you. Commissioner Malone, thoughts?
Yeah, I think I'm leaning to the 5% so we don't get further behind. It's hard to catch up, and so I think that makes the most sense for your budget.
Yes, sorry, I'm just trying to scroll back through my packet. So I know there's a motion for to place it on the next agenda or for the 29th. Is there a motion for setting the percentage?
There is not a motion, but the staff recommendation is to set the adjustment of 3% on average.
Okay,
If I could suggest an option, perhaps we can make a motion to direct staff to bring back a fee order on the 29th at the whatever percentage you decide on. That would give you a chance to make a formal decision in regular meeting. Staff would know which direction they're going with their letters to various businesses, and they can prepare for it.
okay, thank you. I could go either way, I guess, with the, like we said, it's still kind of rough out there. But as Commissioner Malone said, it's always harder to play catch up.
Could-
So,
May I make a comment, please?
yes,
Where we struggle at this time of the year is we have to issue renewal notices to all those licensed facilities, and we're actually on a very tight schedule there. Those fees need to be loaded into the health space program, and the renewals need to be generated and sent out. So I can certainly wait, but I would prefer not to have to wait till the end of November to get that process started. It just creates a ripple effect, and makes it much more difficult to get those revenues back on such a short timeline. We like to at least try to send out 2 renewal notices, and if we waited that long, I would only be able to send 1.
Okay, I think I'm
Right.
I'm feeling a little confused. So today we're deciding on 3% or 5% or
That's
whatever
right.
percentage.
And we'll come back with the
Okay.
order.
So that works for you.
We'll still be able to move forward with all of the preparations.
Commissioners, also I'd like to just interject a little bit about timelines. November is always. Thank you, John. Commissioners, I would like to just interject a little bit about timelines. November is always a challenging month for us because of our Association of Oregon Counties. We do have November 29th as well as Thanksgiving, but we do have November 29th in the agenda checklist as when we were potentially going to bring this back for the board to formally vote on. Yeah, I think you actually have a number of options. One of those is, you could, I believe, make the decision today, and I can't see Vance over there, but if the board wanted to make a decision, you could make that decision today. You also have an opportunity the week, it's 2 weeks from today. So today is November 1st, so that would be what, November 14th, 15th. We do have a brief meeting that day, that morning. And I say brief because the board will be at AOC as well as a staff, but we do have a meeting scheduled for that day. You could bring it back to that meeting with the understanding that that meeting is intended to be short and concise and only have vital topics on the agenda. Or you would have to wait until November 29th when we do have another meeting, which we typically refer to as our information sharing meeting. And that information sharing meeting is usually not intended for agenda topics for approval. But you could make an exception in this case to add it to the 29th of November, also recognizing, however, some of the timing challenges that presents for our health department.
Okay,
Unless there's more information coming or clarification, I think I'm comfortable deciding today.
I think that's fine with me, Commissioner O'Neill.
I would prefer to make the decision as soon as we can.
Okay. And after thinking about it, I think I'm good with a 3% adjustment, 3% on average, correct? Okay. So does someone want to make a motion?
Staff to come back.
I-
Or
no.
you can set it today, but staff will still have to come back with more. Tomorrow morning.
Okay,
I would be happy to make a motion to increase the environmental health fee schedule on average of 3%. And to bring back an order to that effect at the next possible board meeting.
do I hear a second?
That's okay.
Yep.
Second.
All those in favor say aye.
Aye.
Aye, motion carries. Thank you. Any other comments or questions for us before you go? Nope.
Thank you so
Thank
much.
Thank you. All right, and with that, we will move on to, we have an update from our Justice System Improvement Program with Nick Kurth, the program manager.
Hi, Commissioners.
Hi,
This is
just
Nick.
I'm sorry, just one moment. Can we get the screen sharing off, please? We are just, there we go. Okay. Welcome, Nick. Thank you for joining us.
My pleasure. Thank you, Chair, Commissioners, County Administrator, and County Council. Just a brief update for you today, but really laying out kind of the next couple of weeks or 3 weeks. So first of all, next Monday, the 7th, I anticipate receiving final project costing from DLR Group. That's a major milestone and will certainly guide a number of discussions and staff activities as we head into kind of our bond package discussions in December. So just wanted to highlight that for you. Additionally, relative to your recent decision to include homeless services facilities in the bond measure, a subset of the EC team is meeting on 11/7 as well. We've had a couple of preliminary meetings since your decision, but our objective next Monday will be to align on option recommendations for your consideration. Ideally, we would like to bring those options to you on 11/15 at your 11/15 meeting. I just heard Joe Kirby say that would be a short meeting, so we'll need to kind of align schedules. But at this point, we have limited time really to share kind of the direction or directions you may be leaning relative to homeless services facilities with the public prior to your deliberations beginning in early December. And so that's why I am targeting the November 15th meeting to get some kind of direction that we can take back and get some feedback through our engagement process before you start deliberating on the bond package. So I will follow up with Joe and talk about whether it's feasible to bring that to you on the 15th. Let me just pause and ask, field any questions.
Comments or questions?
Don't think so.
Not for me.
Okay. Then the next important date is Tuesday, December 6th, which is our first opportunity, your first opportunity to start deliberations on the bond measure package. Rick and I have discussed an opening presentation. It will likely kind of be a table setting opportunity where we review financials, project costs, survey data, public feedback, any additional funding opportunities that we're pursuing. I think the one decision, important decision that we will potentially contemplate on the 6th is aligning on a bond measure amount relative to our current objective of at or below 100 million. But we'll have further conversations on the agenda between now and then and adjust as appropriately. And then subsequently, I have requested time at each of your Tuesday meetings through December and into early January for conversations, discussions, deliberations. And I'll work with Joe Kirby to schedule those, but want to make sure that we have ample time for these discussions and then any follow-up research or from research that you require, information, et cetera. So that's looking ahead through the end of the year and to the early part of January. Again, I will pause.
I do have a question there. Are you considering that we will make use of the December 27th potential Board of Commissioners date?
I really hadn't gotten that far.
I just trying to look ahead and trying to plan schedules ahead. I would definitely prefer not to meet that week if we can help it.
Yeah. Well, I would agree with that objective, and I think if we have an opportunity to use portion of your goal-setting meeting as appropriate, we hopefully can avoid having need on the 27th. I think we'll have 3 opportunities in December without the 27th, and then up to 2 in January. So hopefully 5 total opportunities should provide time for a solid, well thought decision.
Sounds good.
Okay. Moving on to public engagement. You are receiving the updates, but from Lindsay Goodman, who continues to schedule our small group presentations. As of last night, we have 6 complete, 9 scheduled, including Casa Latina Unidos with a proposed date of Saturday, December 3rd. Brenda just met with them yesterday to align on kind of dates and some of the details. So we still have things to work out, but it looks like that will be moving forward. And then 6 in process that I'm aware of for a total of 21 small group presentations. So I would say certainly the county is making a robust effort to communicate across a broad, diverse spectrum of stakeholder groups. And at this point, I've asked Lindsay to try and solidify the 6 in process, and then we will reassess regarding further tranches of stakeholder meetings. Finally, we've begun evaluating potential third large public forum. Nothing is scheduled yet. We have some support and logistical details that we still need to resolve, but Joe, Corey, Brenda, and I will be meeting following my return to talk through some of those, tentatively for late January. Could be early February, but late January is what we initially discussed. Lots of good feedback from forum number 2, both positive and opportunities for improvement. So I appreciate all of that. I've heard from a number of sources, have already debriefed with Brenda. She's also having a post-mortem. So I think we know it went well. I think we know where we can improve. And if we move forward with the third forum, we'll certainly make additional adjustments.
Thank you.
That rounds out my update, but let me pause for questions on engagement.
Comments or questions?
Yeah, Nick, on the small group presentations, this seems like a great effort, but a little bit early in the process. I guess, have you got far enough along to figure out what kind of follow-up to do with those groups, whether that's a second presentation or send the group updated information and that, hope that they spread it around, or have you gotten that far?
We haven't gotten that far. We strategically, we know what we want to do between now and the bond measure with communications. Just had kind of that high-level discussion last week. And I think we're now kind of starting to dig into more of the tactics and details, but certainly agree that having established these connections and presented to these groups, that's not the end result. And with the connections made, yeah, we do want to continue to apprise them of updates and provide information over the next 7 months. So point well taken. I just don't have a specific tactical answer for you at this time.
I'd like to weigh in on that briefly because at a certain point, the county is going to be in safe harbor mode. And so I think that the PAC that forms to carry this bond measure forward is going to be responsible for picking up the baton and carrying forward a lot of those meetings and forums and community engagement. So I think that's a point that we need to discuss explicitly at one of our meetings coming up in the next month, 2 months, as that handoff and what that will look like.
And when you say at one of our upcoming meetings, do you mean a Board of Commissioners meeting or a different forum?
Well, we could certainly, as commissioners, discuss it at goal setting meeting. It's not necessarily something we would need to ask staff support for, or we could do it at 5 electeds meeting, which would be even more appropriate. So, yeah,
Or both.
or both.
Mhm.
Good. Well, I assume that I can leave that with you. As you know, I in my role need to distance myself from any potential PAC activities. So it sounds like you're not asking for anything from me or the JSIP team, but acknowledging the need for that conversation from your perspective.
Correct. And so we need to have the time at least to launch that in conversation. And it would be very helpful to be able to speak to our coastline folks about that as well.
Commissioners, it would be
Okay.
helpful it would be helpful for me to understand if you intend to have that discussion at a goal setting as opposed to a 5 electeds. Our goal setting for this month is a week from tomorrow. If this was something you wanted to add to the agenda and include coastline in that conversation, I just need time to try and coordinate that. If you prefer to have that at the 5 electeds, then that is an agenda that I don't have to worry about, and that is strictly driven by the board.
I don't know when the next one is, and I'm concerned about timeliness. I don't think it would be necessarily a long conversation, but we do need to just check in.
Yeah, yeah. So if we can have some time at a goal setting, I think that would be good. So when you talk about inviting coastline, what are your thoughts for that?
I think that the other option is for one of us just to make a phone call and have that conversation and to understand what that handoff would most optimally look like and bring that report back to goal setting. So.
Like one commissioner reaching out to coastline, is that what would be the most appropriate way to handle that?
Commissioners, from my standpoint, I can certainly work with Amanda Makepeace to add this item onto our agenda for goal setting next week. If the board would like to appoint a commissioner to have that interface with coastline, I think that is fine. If you prefer that I do that, I can do that. But similarly to Nick, I want to make sure that I have the appropriate arm's length distance from these PAC conversations.
Okay.
It doesn't mean that we can't be present at goal setting to listen in, but I don't think we should actively participate.
Okay, that's good. And I just want to make sure that we're not, that having one commissioner contact them is, perfectly fine. So I'm fine with Commissioner Ojro doing that.
Sure.
Okay.
I'll follow up.
All right, sounds good. Thank you, Nick, and thank you to your team and the communications team. I think we are doing a good job with the public engagement. I've been pleased with that. Not to beat a dead horse, but it's super important. So thank you for all the work that you guys are doing.
Agreed. My pleasure. Thank you for the time today.
Thank you. Have a great afternoon.
All right. Bye-bye.
All right. With that, I was contemplating taking a short break, but I think we will do that after our next agenda topic. We have Adair Village Urban Growth Boundary Process Guidance with Darren Nichols and Greg Brett from Community Development. Welcome.
Welcome. Good morning, commissioners. Nice to see you.
We put together your agenda checklist item fairly hastily. Let me just try to distill that down to one comment and two questions for you this morning. The comment is that we have an invitation from the city council at Adair Village to join them in their process, which is set for hearing December 6th at 6 p.m. In the interim, ideally between now and November 18th, the city is asking, would you like to join the city council for a work session in advance of that hearing on the 6th? So that's kind of the invitation that's before us today. The questions really for the board are two. One is, how would you like to hear from staff the recommendations of the planning commissions regarding an amendment to the Adair Village urban growth boundary? And then secondly, how much of that process would you like to conduct jointly with the Adair Village City Council, and or how much of that process would you like to conduct as the Board of Commissioners? So hopefully that's clear, but we just want to get some guidance from you about how you would best like us to present the information to you as you make a decision. So
Sure.
does that make sense?
I think so. Let's talk it out. Okay, so I would love to join the other body and have joint. I think you said joint work session and then a joint hearing. Is that correct?
Yes.
Okay. If it works with our schedules, I've not looked at the calendar and seen if that works, but that's something I'm personally interested in.
I guess my question in that regard is, I'm assuming that the proposal from Adair Village to do it jointly is for expediency and time savings, because otherwise it can be a protracted process. But I don't know anything about the level of public interest and the level of contentiousness, and whether we would be better off doing it in two stages so that we can hear from a maximum number of people in the community. So without having more of a sense of that, I'm not quite ready to jump into saying, yes, let's just move forward with the joint proceedings.
Commissioner Malone, do you have thoughts? I mean, another option could be having a joint work session and then making a decision. Could that be an option?
Yeah, I think, thank you for asking the question. I think anything that would feel comfortable to you as a body is really what we'd like to accomplish. Obviously, the city is anxious to move forward. They've been working on this for a number of years and are very anxious to have this kind of wrapped up on their end before the end of the year. But that doesn't commit us necessarily to follow the same timeline.
Okay, and then Commissioner Malone, I'm sorry, I called on you and then I interrupted you.
Yeah, I would feel more comfortable having time to get some more detail. I know we've talked about this a little bit relatively recently, but I don't have a good feel for the ins and outs, and I guess I know something about the background, but having a two-stage process, or I think I would be more comfortable with that.
Okay, well, Greg's with me this morning to talk about the ins and outs, not necessarily in detail, but he's been through this for the last several months, working with the community and with the public. So, and there's a lot of nuances, details. There's some policy considerations that I think are important. And I agree with Commissioner Ogerow that we don't know how much public interest there is, but there could be some substantial public interest. And I think it is wise for the board to approach this carefully and make a thoughtful decision, hearing from Benton County public.
I could just add just a little bit there. At the planning commission hearing, there were several members of the public who testified. So I expect that at the Board of Commissioners and City Council, other members or similar numbers of people will be wanting to testify. I do encourage a work session prior to the public hearing, whether you do that jointly or independently. There are a number of policy considerations, and yeah, it's a big matter. Also, a work session is open to the public and could involve some element of public interaction, but public testimony is only at the public hearing. And so we need to be careful to keep that distinct both for ourselves and for the public, that the formal testimony only occurs at the hearing. So just want to point that out.
Sure.
Any other? I see you.
I was thinking when this happened, a number of years ago, when you expanded the south, I think the board and there held a joint meeting. But when it happened with Corvallis, they had separate meetings. I think the challenge we faced with the separate meetings with the Corvallis, if I recall correctly, is Corvallis jumped through the hoop first, and we then were left with having to adopt or approve an exact replica of the city's order. So that was a bit of a challenge. I think I'm remembering that right, Greg, that once the first entity that approves establishes what has to be agreed upon in terms of the joint approval. So that, I don't know if that's going to be a problem here, just know that if the city, if you do opt to go with two separate, a board meeting and a city council meeting to approve the ultimate UDB expansion, if the air goes first, they'll approve something with whatever conditions, and then that will come to you for review as well.
So we don't have any opportunity to modify conditions or to modify.
You could, but then we'd have to go back.
Right.
And,
Yeah.
and I don't honestly, I don't know how that affects the final decision on this sort of thing for appeals to Lumen. It gets
Right.
a little gray.
It does. So our urban growth management agreement with each of the cities, in this case with Adair Village, lays out a process for resolving if the city council and board of commissioners come to different decisions. There's a process for resolving that. It's not been tested in our time, so that could be interesting. But yes, absolutely, you have the opportunity to come to a different conclusion and decision. I think to Vance's point, in some ways that could be a little more difficult or more awkward, maybe in a way, if one body has approved it and then it's before you and there's impetus to just approve that, but you know, of course retain that right.
Sure. And what comes to my mind is if we're having two separate processes, is one body going to hear or receive information that the other body is not going to hear? And therefore you have kind of two different bases for making decisions. Although I think the people who care enough about this probably would be motivated to testify to both bodies. But then you're making the community come to multiple meetings and say the same thing multiple times. How is that also more work for you all, our staff? Maybe it is, maybe it isn't. I mean, I really want to have at least one joint meeting because I think it would be good for us to hear from the people who that this will impact their daily life, where it may not impact our daily life. You know, they are the city councilors. This is their town. I think it'd be good for us to hear their perspective on it.
Hearing the conversation, here's a suggestion, if you'd like. We could conduct a joint work session as soon as we can schedule it. I think that the city council has asked that we do that in the evening or late afternoon if possible to accommodate city councilors' schedules. So if you're open to that, we could schedule the joint work session. I think you'll learn a lot about kind of where you all are, what the issues are. I think there's a lot of value there. The board could also join the city council for a joint hearing on the 6th. And then either beforehand or maybe in the room then could decide whether you want to continue the county's portion of the hearing to another date if you feel like you need more time to explore the issues. Give the board a very good sense for what the testimony is, where the city council's thoughts are as they approach their decision, and then whether and how you might want to conduct the board's decision, either at that time or a date in the future.
And that last option, I think, is one we have done before. It does provide a more efficient process for folks who wish to testify to actually get before both bodies and more efficient for both the city council and the board of commissioners as well. Yeah, so that last option is something that hasn't been done before.
And I'll just note too that the December 6th meeting is a Tuesday and it's their normal city council meeting. So I was already planning on being there as their liaison. So that's convenient for me. I don't know if other commissioners have time in their schedule.
I have another meeting, but it's one that I can skip in favor of this one. I think the work session is going to be much harder just because of the Thanksgiving holiday and Association of Oregon Counties meeting this month. And the fact that I have JSIP meetings on most evenings.
Darren, at the beginning of your dialogue, didn't you reference a particular date in November that the Adair City Council wanted or was planning on having a work session, or did I not hear that correctly?
In the email that we have from the city, they said if you could convey to the commissioners that the above date, that'd be December 6th, as a joint public hearing, that would be best for us all. As for the study session with the commissioners and Joe, that could be anytime they have availability between now and maybe November 18th, the week prior to Thanksgiving. So that gives us,
Next
you know,
week.
just a couple
Actually,
of weeks.
it's really just next week
Right.
that I think we would be able, or we'd have to focus on by virtue of AOC being the following week.
Because yeah, we'll all be out of town at the
Right.
conference.
I'm aware our schedules are backing
They
quickly
are.
between now and the end of the year. So that's what they've asked for. Having said that, I think that the work session could be a fairly light lift for staff. We've been through 2 or 3 of these now. Greg raises one eyebrow as I make commitments. And so I think it's, you know, on your end, it's really a learning session. We can get some materials to you. You would have an opportunity to show up and ask questions and engage in the conversation, but the expectations would be, you know, fairly low in terms of work at this point.
Okay. So I mean, that sounds good to me. Other commissioners, your thoughts?
What sounds good?
What Darren had described and Vance had said that we've done that before, where we start
Oh.
with the work session and then go from there, essentially.
So we have a joint work session, and it sounds like one night next week. And then the board would have a joint follow-up work session / hearing on December 6th.
Would be a / work session. It could be the hearing.
Okay,
Be the first hearing, and at that, the board could either decide in advance that it wants to push its actual decision deliberation to a date after December 6th, or if you prefer not to make that commitment in advance of the December 6th hearing, you could get to the December 6th hearing, kind of touch base amongst yourselves and decide, are we ready to make a decision this evening? If so, make the decision. If not, then continue the board's portion of the hearing to a date in the future.
so we're looking for an opportunity next week at night for the board to meet in a work session jointly with the Adair City Council. And then a commitment from the board to meet jointly with them on December 6th for the hearing.
Thank you. Yes.
And that latter is important. We need a commitment on December 6th because we have to send notice of that hearing date and time to the public.
Greg, is this, I'm super rusty on UGB. Does this involve an ordinance?
Yes.
Okay, so there would be a second reading of the ordinance from Benton County. So our time would be probably much longer in process wise than theirs.
And what time are we talking about on November 8th?
At a date next week, which you can decide if you
Oh.
want now, just sometime in the late afternoon is the request from the city council, or evening.
Yeah, that leaves election day, November 8th, or November 10th, if it's early enough. But, you know, I'm gonna get help with the calendar and figure that out.
So Commissioners, we would work, if you decide that you want to meet in a joint work session one night next week, then I will work with staff in the board's calendars to see what we can make happen. Then we would provide that information to Darren and Greg, and then they would work with
Yeah.
the city of Adair
That's
to try and make that happen.
Thank you.
Sounds good to me.
And-
Do we-
Sorry, and if we're not able to find a date and time that works for both the board and the city council for a work session, are you still wanting a work session on your own? And that's my recommendation. As a
Yes.
fallback, that would still be important to do.
Yes. And frankly, for me, if I can't be there, I don't necessarily want to gum up the works. And would be happy to just read the materials and get up to speed that way.
Also, as it relates to a potential backup plan, just thinking about other dates, commissioners, one of those dates could be the week of Thanksgiving, November 22nd. I think was when we originally had the information sharing meeting scheduled. We moved that to November 29th to avoid having any meeting on November 22nd. So you do have that possibility. And then you also have the November 29th information sharing meeting that we had planned to use in a different manner. But we could, if the board wanted, use that particular date of November 29th to hold a work session during the daytime. So a couple of food for thoughts there.
Okay, so does that sound like a way to move forward?
Yes, I think we need to move this discussion to the scheduling folks and see what we can do.
Right. Did we answer both your questions?
I think so. Maybe I should just, for clarity, play back where I think we landed. Yes, the board would like a work session. Ideally, that would be a joint work session with the city council if we can find a date next week. If we're not able to pull that off, then it sounds like there may be some backup dates for a work session. Under any circumstance, you would like to meet jointly with the city council for a joint city county hearing on December 6th. And we'll determine either in the room then or before we get into the room, whether you would like to continue the county's portion of the hearing to another date. And then also under any circumstance, there would need to be a second reading of the ordinance before this could be a final decision.
Okay, yes, I think that's correct.
Okay.
And do we answer your question about how we would like to hear from staff? Is that
Well, more or less, I think the work session will tell us a lot about the
Okay.
questions you have, about the things that you want, if anything you want us to follow up on further. And I would encourage you to reach out to me or Greg in advance if there are things that are on your mind already. This is a legislative hearing, so we don't have the same kind of ex parte contact limitations that we ordinarily would have. And these are really important decisions. You rarely see an amendment to an urban growth boundary in a planner's career. They might only do 1 or 0. So maybe that's where I should have started. This is a big decision for the city of Adair Village. It's also a big decision that has impacts for Benton County. And I think a thoughtful approach from you all will be valued on our end, and we're here to support you in that.
Thank you.
I guess my comment would be to let the Adair Village folks know that, we appreciate the need for moving the process along, but we also need time to get the information so we can make an informed decision. So
Yes,
kind of
thank you.
balancing out the two.
Yes, thank you.
All right, other comments or questions before we move on? All right, well, we are going to take a quick 5-minute break and then we will come back to item 4.6. that better? All right, well, we will go ahead and come back from our break. And in my excitement for the UGB stuff, I just skipped right over our Benton County Talks trash update. My apologies to Sam Imperati and Darren Nichols. So we're going to go back to agenda item 4.4.
Thank you. No offense. We understand your excitement over urban growth boundaries. I think today's update should be fairly short. I want to start though by thanking Commissioner Wise and also Administrator Kirby for joining the last meeting of the Benton County Talks Trash Work Group. It's always appreciated when you have a moment to join the conversation. And I know the work group members appreciate the support and your continued interest. So thank you very much. I'm pleased to report that things are moving forward very well with the work group and with the subcommittees. I think we're making good progress. The tenor of the dialogue is now moving into substance. It's nice to hear some tug and pull amongst the members. I think they're really beginning to own the work process, if not the product yet, but they're working on that. And so I just wanted to share those two positive things, and then ask Sam to provide a quick update from his perspective and give you a chance to ask questions or provide direction as we do.
Sam, we can't hear you.
Good morning, Commissioners. Sorry about that. Sam Imperati, the Benton County Talks Trash Facilitator. I echo Darren's comments. We are clearly in the performing stage of the process. Each of the subcommittees met before the last meeting and then reported out. During the course of the meeting, especially during the dinner break, it was great to see members of the subcommittee taking time out of their dinner to coordinate with each other, and some offline process agreements were made to get additional data coming forward. Next week, all four folks will meet again, and we are looking forward to the November 17th meeting, which will be a combination work group meeting for the first portion of the time allocated. And the second part will be an open house where each subcommittee with work group members will staff their stations so members of the public can rotate through the various subcommittees in one general station for the process overall, and receive a short presentation, some handout materials. And the subcommittees are going to be working on a survey instrument where we'll take the pulse of those folks that attend the meeting by way of a few Likert scale questions and one open-ended question. All that information will be rolled up and presented back to the subcommittees and the work group for further work. So all things in focus, we're doing well, and I look forward to continuing the progress of the work group. Thank you, and I'm happy to answer any questions or receive any comments or suggestions.
Thank you, Darren.
Just one thing to add too. At our last meeting, we had guests join from, I think, 6 surrounding jurisdictions: Marion County, Lynn County, Deschutes County, Lincoln County, Polk County, and Metro. And I found that part of the dialogue to be really insightful, very helpful. We just very much appreciate our colleagues from surrounding counties willing to share their experience, share insights that we don't always have access to. And I felt like that part of the dialogue was very helpful to the discussion. So I just wanted to say thank you to our colleagues at those other counties as well. And I know as you plan to head to the AOC annual conference, if you have a moment to thank the commissioners from those counties for their staff participation, it is invaluable to us as we try to get our arms around this complicated topic. Looking forward to the next meeting, as Sam mentioned, the next meeting will be an open house, and I expect the level of dialogue and public engagement to just continue to increase, and would welcome any thoughts, guidance, and participation from you all as well.
What is the date?
Sam, help me out. Is it the 17th?
November 17th, and it will probably, the open house portion will probably be in the 5:30 to 7:30 time frame.
We will all be in Eugene at the Association of Oregon Counties meeting.
Aha.
Won't it, that's Thursday, won't it be over by then?
That's the product
Oh,
Tasting.
tasting
visiting.
event, and the kind of culmination of the conference, and I will be there Friday morning, most likely as well.
Well, if they want to bring the tasting portion up to Benton County, we'd be happy to host.
Well, any leftovers, we'd be happy to contribute.
Thank you. Thank you very much.
Okay, other comments or questions? All right, and you know, I just want to put it out there. Please feel free when I make mistakes as the chair to let me know. I need help, so please help me. Thank you.
You were on a roll, but thank you.
All right. So with that, we will move back to item 4.6, which is the development code amendments regarding psilocybin. We have Vance with us, Vance Cronin, Greg Brett, Mac Gillespie, Mara Sargent from the Health Department. And please correct me if I got anyone's names wrong.
Thank you, commissioners. We have somewhat coordinated on this presentation this morning. Decided, Vance, unless there's anything at the start, yes, that you'd like to say, our suggestion is to start with the health folks doing their presentation, and then I can cover the land use portion of it. You can jump in at any point. Or not.
Great.
Well, good morning. I just would like to introduce myself. I'm Mara Sargent. I am the Alcohol, Tobacco, and Other Drug Prevention and Education Coordinator with the Health Department in Benton County here. And
great. And I'm Mac Gillespie, and I'm the Healthy Communities Coordinator, part of the Healthy Communities team, along with Mara at the Health Department.
so we just wanted to share a little bit from the health perspective on Measure 109, which passed in 2020. We recognize that couple months ago, someone from the Measure 109 organization came and spoke to y'all, but we wanted to give a little bit more of a local perspective. As we know, Measure 109 legalizes therapeutic psilocybin services. Oh, there it is. Okay, so psilocybin, as I'm sure we know, is a naturally occurring psychedelic compound. So that's what it looks like. It's found in a bunch of different fungi, and it's been used for thousands of years in indigenous communities, tribal communities around the world. And as we've brought it forward into sort of like the modern era, it's also been shown to have to address many mental health ailments. So things like anxiety, trauma, there's been some success in treatment of addiction using psilocybin as well as other psychedelics. It affects us, everyone in a different way, but mostly it affects heart rate, your blood pressure, your pupils will dilate, et cetera, et cetera, et cetera. A lot of people find that it increases their spiritual well-being, and they find that it makes them feel more connected to themselves, their counterparts, nature, of very deep feeling of connection is the main what we're looking for. Okay, there it is. Oh, go back.
There we go. Thanks, Mara.
Mhm.
We're going to go back and forth on slides here. So again, you probably have some of this background, but I'll just go over it here briefly. So because there is some promising research, some folks a couple of years ago went ahead and put this on the ballot for Oregonians, and it authorized it with the passage of Measure 109. It authorized the Oregon Health Authority to create a program to license and regulate manufacture of psilocybin products for use of people 21 and older. And we're going to go over that a little bit more, kind of what that looks like at the Oregon Health Authority a little bit later in the presentation. And so pretty soon, the Oregon Health Authority will begin accepting applications for the different aspects of it, beginning right after the new year. And then obviously why we're here today, and Greg will talk a little bit more about this. And so part of the law, local jurisdictions will be required to complete a land use compatibility statement. So it's a new business occurring in Benton County, and we have an opportunity to weigh in on that.
And this, so this map shows the rate, that's not the right word, but how much people voted in favor or against this measure by county. And so as you can see, Benton County voted and at a high margin for this measure to pass. So a lot of other jurisdictions are sending this back to the voters on November 8th, saying like, in this city, we would like to ask if you want to outlaw this in our city. And Benton County has not chosen to do that, as you know, because this jurisdiction voted in such a high margin for it to be passed.
So again, jumping back and forth here. So as part of the passage of Measure 109, the Oregon Psilocybin Advisory Board was established at the state level. And so it's a board made up of, I think it's about, you were just on the call the other day, I think it's about 20 individuals from a broad array of different backgrounds. So there's doctors, therapists, mental health professionals, all different kinds of folks advising the state on policy recommendations for the Oregon Health Authority as they're making their decisions around psilocybin therapy. So they're also developing a long-term strategic plan for ensuring that psilocybin services will become and remain safe, accessible, and affordable for therapeutic use throughout the state. And again, and I guess I mentioned this before, but they're getting ready, just because it's kind of a ticking clock here. They're going to begin accepting applications for licensure on January 2nd. And I think Mara's going to talk a little bit about those different licenses here in just a sec.
So in the rules, it's sort of separated by manufacturer and service centers. So there's spaces that manufacture, so like the growing and cultivating of these psilocybin mushrooms. And then that is separate from a service center where the psilocybin will be administered to someone seeking this service. And sort of what that looks like in the clinical sense is there is a preparation session. So someone comes in to see a licensed facilitator, and they say, I'd like to participate in this session. And so they go through this preparation session where they ask them a bunch of questions. And in the proposed rules, the OHA or the OARs, there's a defined amount of rules that have to be, or questions that have to be asked. Specifically, are you on X, Y, and Z amount of medications? Have you ever received psilocybin treatment before? Have you ever had a medical emergency? All of the medical questions, but also like, do you have a mental health diagnosis? There's a lot of background information that is sought in the beginning in this preparation session. And they explain what's going to happen. Here's how long you're going to be here. Here's which sessions, administration sessions are anywhere from, I would say, 6 to 10 hours, depending on someone's metabolism and their height, weight, the whole thing. And so the licensed facilitator will prep them for this session. And then I believe it has to be on a different day that the administration session happens from the preparation session. And the administration session has to be inside this licensed facility, whatever that looks like. And then the land use is a little bit out of my realm of understanding, but Greg will give us that in a minute. And this is where they consume psilocybin, and they sit with the licensed administrator for the entirety of the time that they feel the effects of the psilocybin. And it looks like kind of like a regular therapy session. There's talking, there's maybe some light music playing. People are oftentimes wearing like a face mask or headphones. And the point is just for them to experience this as it happens to them. And the facilitator is sort of like a guide. They're not asking them, to tell them all about their traumas or anything. It's really client led. And then oftentimes there is an integration session or multiple integration sessions afterwards. So after the person is done with their administration session, they leave the site and then they come back days or weeks later, once, multiple times. This part is not required under Measure 109. The integration sessions are not required, but they are suggested. Because then it's really about integrating what the person's learned in their administration session through their work with that licensed facilitator. That is sort of the sense that I'm getting that most people are interested in, is like a clinical setting, like you go to a therapist's office. We're seeing this mostly connected to something like ketamine therapy, where you go to a doctor's office and you sit there for the duration of your treatment, and then you leave the space and you are no longer under the influence of that substance. There's rules for getting the psilocybin products to the service centers because the land use is a little bit different between the service centers and the manufacturing centers. And this isn't like this is all guided. So it's not consumption and then you leave. There's someone there making sure that you are no longer under the influence. They have a travel plan. They have an emergency plan. There's all sorts of things that are required under the law to make sure that we're keeping folks safe.
Just following up on the same slide, right? My understanding is that there's kind of 4 different kinds of licenses. So there's like a license that's going to be needed for the manufacturer, for the growing, obviously for like the service centers themselves, and also for these facilitators. And Mara was digging in a bit into like, it's a pretty robust training program for the facilitators. I think it's about 100, it's like a required 120 hours of training. And so there's a lot of different pieces that go into that. And again, obviously today, about a month ago, I went to a psychedelic conference up in Portland, really focused on, a lot of it was focused on this Measure 109 starting. And it really, the interest will be, it seems like in these service centers, I think kind of the money, a lot of what entrepreneurs are interested in, it seems like isn't so much the growing itself is a pretty simple thing to do. And it was really impressed on me that like in a room, I don't know, like a quarter this size, you could grow all this psilocybin that you need for everybody in Oregon for an entire year. And so there really isn't as much money in the growing piece, but really there's going to be a lot of interest in this service center. Mm-hmm. So kind of those 4 different licenses that are there. Other jurisdictions. So we did just briefly look, and again, Greg might get into this a bit as well. Go ahead. Yeah. So, and again, thanks to Mara, did a lot of this reach out that, so of the 36 counties in Oregon, 32 have some kind of local measure on the ballot next week around psilocybin. And so some of them are at the county level, some are looking specifically at unincorporated areas, some are looking at cities. So as you probably know, for example, Philomath has on their ballot to potentially, so I think they don't have a permanent ban, but it would be a temporary ban for the next 2 years. And so there are just 4 counties in Oregon that decided that don't have any kind of ballot on at all. That's Gilliam, Multnomah, Wallowa, and Wasco counties. And so you see Benton County kind of falls under that less than 2 because we have Philomath as one of the jurisdictions. And so in that research, again, Mara we reached out to folks in Gilliam, Multnomah, Wallowa, and Wasco just to try to understand kind of where they are in their process as well. And we didn't really hear back. Doesn't sound like there's much going on in Gilliam, Wallowa, and Wasco. We didn't hear back from those counties. But in Multnomah, from best that we can understand, they're in a pretty similar kind of state where we are, where they're kind of thinking about the land use considerations, what they want to do. And I don't know, I mean, maybe I can let you speak to it, or maybe I can just briefly mention it. It seems like, and I kind of pulled this from their staff report that they're going to have next week, and I'll just read it here. So Multnomah County Code currently identifies zones where general types of different businesses can occur. Oh, wait, I'm reading the wrong thing. Sorry. So they're kind of leaving it. So they say, although it's difficult for staff to estimate potential impacts without real world examples of business operations, they don't believe there's an immediate need to draft local psilocybin time, place, and manner restrictions. And so I think that their way of looking at it is that the state kind of has this program going on. They'll see what happens, and if in the future there's a need to amend the code, they'll do that. But in the meantime, that's at least what staff is proposing for their commissioners for next week. And so we'll kind of see. It's one of those, like, we're kind of building the plane as we fly it situations, because it's, the deadline's coming up pretty quickly. And so, and again, as far as we could tell from the other counties that are in a similar place, we don't really know at the moment. And I don't know if there's anything else that you would want to add, just again, that you did a lot of that looking into these. So I don't know if there's a next, is that it? Oh, again, this is just kind of where we pulled some of our information from. And I don't know if you have any questions now, or if you wanted to hear Greg's piece, or
Well,
we'll
let's
be
see,
here
are
too.
there any quick questions?
Yeah.
Before we move on to the land use piece?
Oh, you mentioned Philomath, and that's a 2-year. It's on the ballot, the current ballot, to either approve a 2-year moratorium, or go with what we already voted on.
Yeah. So we'll know in a week.
Well, and I appreciate the background information, reminded me of how strongly that was, the 109 measure was approved in Benton County, and I've been impressed with how careful a process, and you mentioned 120 hours of training and the facility, and just we get a lot of information about mental health issues and lack of services, and I mean, this seems like a tool that with how carefully the process is designed, I'm comfortable moving forward. But so if Philomath votes to do the moratorium, it would be all of Benton County would be in this process, except for the Philomath.
Again, yeah, that's my understanding. And again, I don't know how that would work from like a land use perspective, but right, I guess within Philomath, they would opt out from, I guess it would be any of these different, or, they wouldn't be allowed to have service centers, or, a place where you could grow or manufacture psilocybin.
Yeah, that's my understanding as well.
I appreciate the background.
And just to clarify, so any changes that we adopt is just for the county outside of incorporated areas?
Correct.
The city of Corvallis, for example, is doing their own process for their land use.
Exactly. Right.
All right.
Okay.
To
We'll
you, Greg.
switch to the land use side of things, and I have a few slides, but I'm going to start with just no slides yet, please, Erica. Thanks for the great background and the bigger picture. My focus here is the Benton County Development Code, and how and whether the county adopts amendments regulating where and under what circumstances or what standards the various elements related to the psilocybin can be carried out in Benton County. First of all, a process note, I'll remind the board, this is a little unusual. We're doing a work session right now. And then at noon, we will be doing a public hearing with the potential first reading of the ordinance. If you have changes that you decide to make to the ordinance, you need to read those into the record, is my understanding, before conducting that first reading. And then we would have the second reading of that ordinance 2 weeks later, which would mean the ordinance goes into effect before the end of the year, which is our deadline. We do have a little bit of wiggle room in that, but given your schedule, that's challenging. We could, if necessary, the public hearing or the reading of the ordinance could be bumped back a bit. We just need to do the first reading before the end of November, I would say. Alternatively, you could adopt an emergency ordinance that would go into effect immediately. But I'm hopeful that we can get through the process through the normal first and second reading, 30 days.
Yeah, and I think that the timeline that is in front of you allows for that. If you opt to enact the ordinance and conduct the first reading today, you do have the opportunity on the 29th of November to conduct that second read. That would give the 30-day charter required timeframe before it becomes effective. It would become effective before January 1. So the timeline does allow for you to have that second reading at that 29th meeting, because I know your December schedule is a bit wonky. That's a legal term. Wonky.
And I believe the second reading has tentatively been scheduled for prior to the 29th.
Yeah.
I can't remember.
November 15th.
Okay,
Yep.
right.
Our super short meeting.
Yeah. But just know that
Just
there
for
is
you.
there is potential for like, oh, I feel very special. Thank you.
And I guess the other thing, I just wanted to just piggyback on something Greg said. We had anticipated an emergency ordinance because we didn't know if the planning commission was going to be able to consider and make a recommendation within the time frame that would allow this ordinance to be enacted. Obviously, they have, and so that is why you don't see in front of you the emergency ordinance as a companion ordinance to what's in front of you.
Okay, thank you.
All right. Any questions on the process?
Nope.
All right. So as you know, ballot measure 109 adopted in November 2020, the program becomes effective January 2nd, 2023, and any land use regulations that affect or any regulations at the local level need to be in place at that time to create a level playing field for all potential applicants or participants. Staff recognizes the limited time, our own limited knowledge and experience dealing with the land use elements related to psilocybin. And so we have put forward a draft code that we think is strikes a balance, cautiously enables these businesses to get established while minimizing the likelihood of potential offsite impacts. It is a state program, as you know. Local governments, though, are able to regulate the time, place, and manner. In our case, we are proposing to put those regulations into the development code. So essentially, we are regulating the land use around the growing, processing, and distribution, if you will. I put that in quotes of the psilocybin. Staff developed a draft code based on the measure itself, the text of it, concepts from other counties, and the existing logic and framework of our own development code. There are a number of different ways to approach this. I heard, for example, Multnomah County choosing essentially to just go with their existing code around any similar types of use. I guess this would be considered. And I think the city of Corvallis is likely going to end up in a similar place from my most recent discussion with them, with their staff. They don't have a set of amendments in preparation, so they will likely be considering psilocybin treatment, for example, service centers as similar to other clinical or medical services. So we have at the staff level developed a code based on our existing code framework, and that goes along with that goes the existing framework that we developed for marijuana. And I point that out both to draw a similarity, but also more importantly to draw distinctions. There are some similarities in that it was a previously illegal substance that was made then available, and there were land use implications to it. Two of the key distinctions between the two, though, are with psilocybin, as you heard, the growing part of it is not likely to be a significant land use, and from what I understand, not likely to have significant offsite impacts compared to marijuana and hemp. Secondly, the distribution occurs in a very controlled setting as opposed to retail sale. So very different in that regard. So as I mentioned, the objectives were that we laid out, and I think the planning commission agreed with these in principle. The objectives of this set of code amendments before you is really to set up a basic framework that can be modified over time, that enables businesses to get established, enables people to access the service, and at the same time limits offsite impacts. I would anticipate a return to this code in the not too distant future. The idea is not that we don't have time to get this necessarily 100% perfect, but let's get it good enough for now, and understanding that we can return later. Along with that goes the principle that while we don't want to be overly restrictive, it is certainly easier to loosen regulations in the future than to tighten them up in a case like this, where businesses may have already been established. People may be expecting or have a vested right in establishing a land use. So at this point, Erica, if you could pull up the slides. So the Planning Commission held a hearing on November 18 and received public testimony, had a fair bit of discussion among the planning commissioners. And this is their recommendation. It differs only slightly from the original that staff proposed. We in the Benton County Land Use Framework use a little bit different terminology than the measure does. So our code distinguishes growing or production from processing, whereas in the measure, all of that gets lumped under the term of manufacture. But growing of the psilocybin producing fungi is, per the measure, is a farm use. And so we are required to allow that in our exclusive farm use and multi-purpose agriculture zones. Additionally, the Planning Commission recommended that production also be allowed in our industrial zones. And per the code, the draft code, it would thereby be prohibited in all other zones. And that includes home occupations or cottage industries, which are very small scale, home-based businesses. Again, growing and frankly, I think the processing are intended or expected to be fairly small scale land uses, but we still need to specify them. So processing, again, as a farm crop, the fungi is allowed to be processed as a farm crop in the exclusive farm use and multi-purpose agriculture zones. That would also be allowed in our industrial zones and prohibited in other zones in the county. The treatment service centers is where more interest is likely to arise. And per the proposed code, it would be allowed through a conditional use review, so not as an outright permitted use, but with a discretionary subjective evaluation of the suitability of a given site. In our urban commercial, rural commercial, village commercial zones, and the airport industrial. And the reason for those zones is those zones currently have provisions for medical clinic or clinic type of uses. And so our thinking is that it fits within that logic. That's why the industrial park zone is there. Not that logically that's a place for treatment service centers, but that is a zone that allows similar uses. The treatment service center would be prohibited in all other zones. And in the draft code, there is a minimum distance separation from service centers from certain other types of land uses and facilities. The measure, as you may be aware, includes a separation distance from schools for these service centers. The recommendation from the Planning Commission is to also include a distance, same distance, 1,000 feet from daycares, public recreation facilities, and other psilocybin treatment centers. The code includes limits on hours of operation and prohibits overnight accommodations unless the zone already allows that, allows overnight accommodations on its own. And those are two areas that we heard testimony, public testimony on the planning commission discussed. I'll come back to those in a minute. Finally, just three key things that psilocybin related businesses are not eligible for, and that's a farm related dwelling. You may recall with marijuana, that was a big consideration as well, probably much more so in terms of the amount of revenue generated by the crop, but also making that clear here. Also not a farm stand, again, retail sale is not allowed. And commercial activity in conjunction with farm use, which is a land use category that is somewhat vaguely defined at the state level. But through a series of court cases over the last 40, 50 years, has come to be understood as a commercial activity that occurs on a farm property, which is intimately tied to farming, whether that's as a market for local farmers. In other words, they purchase crops from the area and do something commercial with it, or as a source for local, a service provided for local farmers, such as tractor repair, for example. We think there's a fair bit of discussion about whether this land use category could be utilized to allow psilocybin treatment service centers to occur on the same property that the growing is occurring. I think that's a pretty tenuous connection, and I think it really needs to be hashed out at a state level, or at least at through a more informed conversation over, frankly, over more time than I think we have in order to get this program into place. And so I think it's clearer to the public and safer legally to simply state in our code that at this time it's not allowed. So that's the code in concept. Yes.
Yeah, I got a question on minimum distance. So what's the rationale? Separating others, psilocybin treatment centers.
This was an example that came from one or two other counties. I think the rationale is, well, I think it's all of those separation distances I think are open for discussion and reconsideration. But I think the rationale is to not see multiple service centers adjacent to one another in a way that might circumvent intentions to keep small scale. I have not seen or heard direct evidence of that being an emerging issue, but that's the rationale that I have heard described.
Yeah, I had the same question, and it doesn't. In most of our rural zones where this would be allowable, they're not very large. So I would think that it would preclude more than one business from establishing itself anyway. So I think that that's the limitation that I'm probably least comfortable with, because I don't necessarily see the need for it.
I have some maps. I have some maps later in the presentation that will show the effect of that. And I think all of these separation distances are very important for you to consider whether they're appropriate or not. Sorry, Chair.
No, and maybe I'm getting into deliberations a little bit, but yeah, I mean, like you said, it's easier to loosen regulations than tighten them later on. And we don't necessarily know what the demand is going to be anyway.
Right. Yep, those are also considerations.
May I ask a more clarifying question? It's a little bit off target, but the commercial activity in conjunction with farm use, is that also what allows wineries to host events?
Great question. No. So
Okay.
it used to be, but wineries recently, well, anyway, wineries now have a separate section in statute, administrative rule, and as a result, county code. They are treated as a separate type of land use. They do have some of the similarities of commercial activity in conjunction with farm use, but they have their own set of rules allowing production as well as wine related commercial activities, sales, etc. promotion of wine, and then separately, through a separate land use process, non-wine related events. You can host weddings, birthdays, etc.
Okay.
That's all through a separate special set of statute for wineries. All right, moving on. Just again, for comparison, this was asked for by the planning commission, so I put this table together, included it in your staff report as well. Psilocybin in our development code as proposed compared to recreational marijuana that is currently regulated by our development code. I'm not going to run through all of this, but there are definite similarities and definite differences. If you have any questions, happy to go through that, but I just wanted to mention it. All right, moving on. So the planning commission's recommendation is in your staff report. It's what we just discussed. But I want to point out a few topics that the planning commission, the board of commissioners may particularly want to consider, some of which have come up already. First, in the category of the treatment service centers, there are really, in the unincorporated Benton County, fairly limited location options. If this code is adopted. The separation distances from other land uses may be further limiting. As I mentioned, the separation from schools is mandated by the state, and the state implements that. We don't have to have that in our development code. If we do have separation distances in our development code, I'm suggesting including the state's school separation, just for clarity, so that all the separation distances are included. But if you choose to remove the other ones, we don't need to have the school. Treatment service centers in rural settings does not appear to be allowable under current state land use rules, or at least it's significantly limited, and that is a difficulty for, I know, a number of providers or potential providers would like to make use of rural settings.
Yeah.
I think that is an issue that needs to get worked on at a state level. And then overnight accommodations, as I mentioned, that also is in some models, some treatment models, to allow at least long hours or possibly overnight accommodations. Under our code, the logic of our code is such that, from my perspective, if a zone allows overnight accommodations, then whether that's as a standalone use or in conjunction with a clinic, that seems to be appropriate to allow. And some of our commercial zones do allow it. The logic of the code is such that allowing overnight accommodations in an area that doesn't already allow that changes the land use of it. It's not to say that that's, forbidden, that you can't allow that, but it's just in the logic of how the code is laid out. And then a couple other considerations around growing, again, not a major part of the land use anticipated, but per the draft code, it would not be allowed to be grown in the forest conservation zone, even though most farm uses are allowed to occur in the forest zone. And it would be allowed in industrial. I'm going to go next, I think, to Erica, if you could bring up the PDF with the maps, show the some mapping that was done by our wonderful health folks and the epidemiology team in particular. To illustrate the challenge faced. I'll go back to the city of Corvallis, obviously the largest city in Benton County. I don't have a map showing where it would be allowed in their zones, but it would be allowed, excuse me, in zones that allow medical clinics. Is the direction it seems to be going, and that's much more significant than the areas you'll be seeing here. So thank you, Erica. All right, so this is Benton County as a whole, and the dots are hard to see. But I'll point out that yeah, thank you. So the red dots are the rural commercial, and that is the dispersed areas, particularly in the northern part of the county. Any of these commercial areas would allow the treatment service centers. So they're typically found within unincorporated communities, Alsea, Wren, Blodgett, Summit, Kings Valley. There's also, and then Alpine and Bell Fountain. And then there are urban commercial areas inside the urban growth boundaries of Corvallis, just one spot up at Lewisburg, and Monroe on the south side of Monroe. And then the airport industrial park out of the airport. So yeah, good, thank you. Oh, right, it's not slides. Forward. Okay, and again, I didn't put this map together, so I'm not as familiar with how it's derived, but what I understand it's showing is, for example, in the upper left corner, community of Alsea, the village commercial is green, and the school, Alsea School there is indicated, and then 1,000-foot radius from that school means that really only the western portion of the village commercial would be potentially eligible for siting of a service center. Lewisburg, that commercial area is all within the 1,000-foot school buffer. Bell Fountain, similar, and Monroe, can't quite see it. Can you scroll down a little bit, Erica? Thank you. So there's a majority of that site is outside of the 1,000-foot area. What we don't know are locations of licensed daycares, recreation facilities, or other potential psilocybin treatment services. So certainly limited opportunities for siting in unincorporated areas at this time. And the other maps, I think, are just blow-ups of the more rural locations. But any questions or discussion that you'd like to have with these maps? These are not in the packet. Sorry, these were put
I'm
together.
just noticing that others have copies of maps on their computers, and
Oh, this is from Zoom. I'm on the meeting.
oh, got it. That's why.
So complicated. Yeah,
Okay.
we put this together.
No, it was a couple of our epidemiology interns at the health department put these together in the last couple of days, so.
Got it. Well, thank you. I was wondering if I was missing something, but yeah,
Sorry.
nope. Now I understand.
And just to clarify, Greg, these radius that prohibit the psilocybin service centers, we can't do anything
No.
about because they're
Correct.
state mandate.
Correct. Yeah, thank you.
So even if the board were to say, we're gonna remove the daycare and the psilocybin service center from our list, wouldn't make any difference.
None of those.
Within those zones.
Exactly.
It might in Summit or now somewhere else, but
Right.
we don't know.
Okay. Erica, if you could switch back to the PowerPoint, thank you. So I think what's left is really just a kind of a wrap up. Okay. Great. Okay, we went through that. Topics. Okay, right. So just coming back to the proposed concept. Yeah, I guess at this point, I'd just like to open up for questions. And again, we will have a public hearing at noon. I expect you will hear some public comment.
So I have a couple questions. The conditional use process, what level does that rise to? Who approves that or not?
As it's structured in the code, draft code, it would be a planning official conditional use permit, which most are.
Okay.
That certainly could be modified.
So could you just walk me through, like, let's say, I'm someone who would like to open one of these. What do? I come and talk to you and file an application and.
Right. So as Mac and Mara mentioned, there's a land use compatibility statement that is part of the state's licensing. So I believe somebody would start with the state, get their licensing paperwork, and as part of that, they're given a land use compatibility statement to submit to the local government. Local government looks up the zoning and decides, is this land use allowed outright? If so, we sign the form, give it back to them. If it's a conditional use, then we hold on to the LUX land use compatibility statement and tell them they need to apply for a conditional use permit before we can sign the LUX. Then they apply, they address the subjective criteria within the development code regarding compatibility with neighboring uses and potential impacts to public infrastructure, things like that. Planning official sends notification to area property owners, receives public comment, writes a staff report, issues the decision, and that decision is appealable by any of the parties to the planning commission.
Okay.
And then ultimately to the board.
Thank you. And so all treatments or service centers will have to go through the conditional use review. So it's not outright
In any
allowed. Okay, but the growing or production would be outright be an outright use in some of these zones listed.
Yes,
Okay,
exactly.
Thank you. I also have a question about the setbacks. What can you give me an example of some of the setbacks? What those would look like?
Are you talking setbacks from property lines or separation between uses?
Any of those that you can share? So I see that the planning commission opted to remove like a 60-foot and 100-foot. Is that correct?
Right.
Okay.
Yeah, in the staff draft, based on some other examples, we included larger setbacks than those zones would typically require for processing, for example. So in the absence of additional setbacks, the standard setbacks of the industrial zone, for example, would apply to manufacturing. And that's, I don't have the numbers off the top of my head, but it's typically it's a larger setback up front. I think it might be 60 feet up front, but then the rear setback is 25 feet, I think, and maybe 8 or 10 feet on the sides. So fairly standard setbacks, and just nothing additional.
Okay.
Based on the
Thank
type
you.
of use.
Yeah. Looking at number 3, which is titled citing standards and review processes might be either too restrictive or too permissive. So I was like, okay, clear as mud.
Exactly. Well, that's, yeah, it's kind of what we're dealing with. And I just entering into an area that we haven't had experience regulating as a land use.
Sure. Okay. And I can definitely appreciate that. We have a short timeline and we need to get something going, and we can always come back to it in the future. Other comments or questions, commissioners?
Just a comment, it seems restrictive, but you get something in place and then I guess adjust as necessary or as conditions play out, figure out how to make this work better. So I appreciate the effort and that it's a little bit hasty, but seems fairly thorough. So
I have one question, and that is that as you described the process a moment ago, I'm assuming that someone could decide that they want to open up such a practice service center and go to OHA and engage in that process. And I'm assuming there will be a fee associated with that to the state. And then only when they come to us for the Lux will they discover that it's a conditional use and that all of the effort and investment they've put in so far could come to a grinding halt. So I just want to make sure that we, if that's the way we choose to go, that we are clear about promoting that to people so that they know in advance, and we don't have a lot of, I don't think there'll be a lot, but so there aren't disgruntled parties that discover that our process is not so straightforward.
Yes, agreed that getting the information out will be important.
Yeah. And I can understand wanting to start out with a conditional use process as a precautionary approach, but we will learn.
So I have another question. The piece about not allowing growing in the forest conservation zone, I guess, is the significance there? I mean, I guess my question is, why would we allow it? And is it just because of the farming, most farming uses are allowed in forest conservation?
That's essentially it.
Okay.
We have a definition of farm use that applies in the farm zones and in the forest conservation zone, and a separate definition of farm use that applies in all other zones. So this would be a distinction within that definition of farm use that applies to farm and forest.
So it's more or less to kind of clarify.
Yeah,
Okay.
I also didn't anticipate much demand to grow it in the forest conservation zone. There's plenty of other locations, but
With you know, this kind of fungi are found in forests as well as, you know, a farm setting. So
sure.
I understand that people might be looking to forest conservation zone as well. Although, as you say, it's not going to take much manufacturing to supply a large number of service centers. So I think what we heard this from the folks that came to talk to us previously, but are there going to be, as I understand that there's going to be chain of custody for the psilocybin, and there will be some sort of quality control, and so that dosage will be regulated rather than being erratic?
Yes, so the Department of Agriculture is involved in the regulation of that. And as far as I understand it, I've read through the proposed rules a little bit. It's not, people can't go out looking for mushrooms and bring them back and say and give them to a service center. You have to like have your space where you grow them, and then you know, put them all together, put them in capsules, or however it is you're going to give them to the service center, and they have to be labeled with how much is in them. They have to be tested. They have to have like a timestamp. They have to have all of this information. You give them to the service center in specific dosages, and the service center administers. That's an important distinction. They administer the amount that is appropriate based on someone's height, weight, which they understand in the process of their 120-hour education process. And then anything that is left over from a session must be destroyed.
Okay.
So we're not like saying, here's a batch of mushrooms, you take one, you take one, you take one, and then on the side, I'm going to go sell these somewhere else or whatever. So it must be destroyed after each administration session if there's nothing left over, like the cap is broken or whatever on the bottle, however that works.
Okay. And when you say, you know, people are growing the mushrooms, bringing them in, you mean like a licensed?
Yeah, you have to be licensed to grow them. So you have to go through the state process to be a licensed manufacturer of these psilocybin mushrooms.
And that's all regulated and
by the state.
And I'm mostly just saying that for, you know, anyone listening in.
Yes.
Okay.
Yes.
Perfect. Other comments or questions from my fellow commissioners? I guess I'm happy to hear that the growing and production might not be as impactful as maybe we were afraid of, and that it's really just going to be the impacts of the treatment centers. which sound like they probably maybe won't be that impactful, but we will see as time goes on. Any other comments or questions? Anything from county council? Nope. All right. Anything else that you would like to provide to us before we move on?
I think I should probably mention that I sort of represented it as like a one-on-one person to, or like client to administrator process. There are multiple ways in which that can happen. So oftentimes it's multiple administrators and one client, but there's also the potential and the allowance in the law for group sessions. And in the rule, I believe it's 25 people to one administrator is the cap. So if we're doing things inside, if the land use code only allows for people to be indoors, the maximum occupancy, I'm sure, matters there. But so I just wanted to make sure that I didn't misrepresent that it's always just like a one-on-one session, like a traditional therapy session. There's group therapeutic events and effects as well. So that is something else to take into consideration.
Thank you for clarifying.
Mhm.
And yeah, it sounds like the whole process from start to beginning is regulated and has been very thoughtful, which is obviously important. All right, well, thank you. And
Thank
we
you.
will come back at, well, we're not going to leave, but we'll have the public hearing at noon. And in the meantime, we will move on with our agenda.
Thank you.
Thanks for your time.
All right, well, that takes us into our business meeting. And first up, we have the consent calendar. Do I hear a motion to approve or make any changes?
I'll move to approve the consent calendar.
Second.
All those in favor say aye.
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 Motion carries. And that will bring us to our proclamations. We have item 6.1 in the matter of recognizing November 11th, 2022 as Veterans Day in Benton County. And with us, we have Molly Murphy, the Oregon Cascades West Council of Governments, to read the proclamation for us. Welcome, Molly.
Hello. All right. So the United States Congress has provided that November 11th of each year shall be set aside as a public holiday to honor veterans. With respect for and in recognition of the contributions our service members have made, we urge all Americans to recognize the valor and sacrifice of our veterans. And the officers at Oregon Cascades West Council of Governments and residents of Lynn, Benton, and Lincoln counties have the deepest gratitude toward all veterans and honors the commitment and courage of the many people who have served in the armed forces. Therefore, be it proclaimed that the officers at Oregon Cascades West Council of Governments proclaim November 11th, 2022 as the day set aside for honoring our veterans and their families and for holding activities in observance of their contribution to our community, our state, and our nation. Thank you.
Thank you, Molly. Comments, questions, or do I hear a motion?
I would move approval of proclamation number P 2022-21.
Second.
All those in favor say aye.
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 Aye. Motion carries.
Thank you, Molly.
All
Thank
right.
you, guys.
Thank you.
All right, well, with that, we can move on to old business. And we have 8.1 in the matter of approving the minutes of August 28th, 2017 joint work session with the Fair Board. And as is our practice, we normally do not, commissioners who are not at a meeting usually do not vote. However, state law does not mandate that. And only one commissioner from that meeting still is on the board. So we will make an exception to our practice today and all three of us will vote on it.
And just to clarify, if you'll note on the minutes, there's only one signature line as well. That would be for Commissioner Oswald.
Okay. Noted.
Noted.
I would move approval of the minutes of the joint meeting of the Benton County Fair Board and Benton County Board of Commissioners from August 28, 2017.
I'll second that.
Motion made and seconded. All those in favor say aye.
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 Motion carries.
I'm a little disappointed you didn't ask Zan for a minute by minute recitation of what happened.
You know, Moving on, Vance, moving on.
Just a comment, was familiar with this, and since it's not written down anywhere, I mean, I feel quite comfortable voting to approve minutes that I wasn't there if I have the information to have an informed decision. My understanding is this was one commissioner years ago said, well, I wasn't there, therefore I'm not going to vote on it, and that's fine for one commissioner in the past, but I don't feel obliged to keep with that concept.
Okay, I agree. I mean, it's coming from the city of Corvallis. You have changes in counselors and advisory boards change, and it's just this the standard practice to, approve it or make changes, I guess, if you wanted to, but.
And vice versa. If I was there and not paying attention, I might say, well, I will abstain on this one.
Okay, well, this could be a conversation for another meeting, maybe like goal setting or something like that. Does that sound good?
Yep.
Okay.
Commissioners, just to clarify, from time to time, as we go about doing our quality control, we find things that.
Joe, I think, are you muted?
Oh, thank you. From time to time, as we're going through our quality control process, we identify things such as this. And so while this is certainly not the norm, it does occur occasionally. And when we do discover that they haven't been formally approved by the board, we always bring those back to the board to ensure that that process has been closed. So thank you.
Yes, and thank you to staff for catching this one. I think, was it Teresa that found this one?
Oh, yes.
Yeah.
Yes, it is.
Thank you, Teresa. Okay, well, we will move on to item 8.2 in the matter of conducting the second reading for ordinance 2022-0312, removing the sunset date of Benton County Code, Chapter 40. And we have with us Rebecca Taylor, Hope Project Manager.
So I appreciate the opportunity to return to you with this opportunity to conduct a second reading for Chapter 40 to remove the sunset clause. And upon the reading of this, it will go into effect 30 days from now, which is.
You're stealing my thunder.
I'm so excited because I had a little challenge with this one, Vance, as you know, so I really wanted to try to say it here so that it was devoted to memory for a long time. So pretty exciting. So I'm happy to be here and answer any additional questions you might have since the last time I came here.
Any comments or questions?
You happy to make a motion?
Yes, please.
I move to conduct the second reading of the ordinance removing the sunset date of Benton County Code, Chapter 40.
Second.
All those in favor say aye.
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 Motion carries.
And so I'd like to conduct the second reading
Yes, please.
for the Board of Commissioners for the State of Oregon, County of Benton, in the matter of removing the sunset date of Benton County Code, Chapter 40, vehicle camping at religious institutions, ordinance number 2022-0312. Now therefore, the Board of County Commissioners of Benton County ordains as follows: short title, removing the sunset date of Benton County Code, Chapter 40, regarding vehicle camping at religious institutions. And I'm not going to say when it goes into effect.
December 1st. December 2nd.
All right. Very good.
2022.
I did notice that you added a
I added a
number
word, yes,
because the chapter number was
missing
missing
part
in the short title.
part 1. So if we could just have that added in, that would be good. It's under part 1. Yeah, it's sometimes you just read those things in.
All right. So that was an addition that you did need to make or did not need to make. I'm
And
sorry.
it's just a scripter's error. We can
Okay,
make that.
perfect. Thank you. Thank you so much.
Thank you.
All right, and with that, we can move into new business. Item 9.1. Discussion and adoption of Order D 2022-080 for natural areas, parks and events, 2023 fees. And we have with us Lynn McKee, our Natural Areas, Parks and Events Director. Thank you for coming today.
Good morning, Commissioners. Thank you for having me. I just wanted to bring forward our annual request for increases of fees for services. This covers natural areas, parks and events. So we're looking at fee revisions impacting Bazell Forest Education Center, Benton County Event Center and Fairgrounds, Benton County Fair and Rodeo, Benton Oaks RV Park, Salmonberry Campground, Alsea Guard Station, Crystal Lake Cemetery, Benton County Park Picnic Shelters, and special use permits. So we have a lot of fees. And so a majority of these fees are just the usual 5% increase that we usually apply to help cover expenses. Of course, the way expenses are going, 5% isn't going to cover it, but we didn't want to also just jar any of our renters by really super high increases. One of the items I wanted to bring to you was the nonprofit discount at the Benton County Fairgrounds. We traditionally provided a 30% discount for 501c3 and 4s, and we are recommending that we go down to a 25% discount next year. We surveyed the other fairgrounds in the state, and we're being particularly generous. So we thought we would start to kind of step down a little bit, maybe 25 next year, 20, and maybe get down to 10 or 15%. Most fairgrounds do not offer any discount for nonprofits. We're the ones that do, and we're the only ones that offer 30%. So I kind of like the idea of offering it, but I think starting to kind of ramp it down to a little bit more reasonable level. But we don't want to jar our nonprofits, our annual events by really hitting them with a big cut in their discount right away. So that was one of the items that we'll be looking at coming each year. So were there any particular questions? There's a lot of fees there. Were there any particular questions about any of the fees that you saw? Comments or questions?
Just a follow up on the nonprofits. I remember the discussion that traditionally, oh, we're a nonprofit, and then you qualify, and now as part of this fee change, we're going to require that they prove that they're a nonprofit. Do I have that correct?
Yes, when I arrived, nonprofits were any nonprofit. And so actually this was a discussion with Vance Croney and Mary Otley that we had decided that because there's nonprofits that are just member benefited and there's nonprofits that are social clubs, we had deemed that the nonprofit discount should only go to 501c3 and C4 organizations because they have that obligation that their funds go back to supporting the community. So we liked being able to provide that discount so they can have, we do a lot of fundraisers at the fairgrounds to support these organizations. So they do need to offer us they do need to provide their IRS determination letter. We don't just take it for granted that they're a nonprofit.
I think that makes sense.
Yes.
I mean, have clear distinction there.
Yes, we cleaned up that policy. Yes.
I mean, I have a business and sometimes we're a nonprofit. But,
yes. Well, we'd have people say, well, we don't make any money on the event. Well, that doesn't make you a nonprofit.
So I support going down to the 25%. I still think that's fair, especially since you said no one else is doing that. And of course, we will always want to be thoughtful when we're raising our costs, but we also want to try to cover some of our rising operational costs.
Yes.
Yeah.
Which have been significant. We did not make any price increases in 2020. So, but we did go in 2021 and now, and then 2022 will be pricing into 23. So we're still very reasonably priced for our facilities, which is a goal. We want to definitely be able to make ourselves accessible to a lot of organizations and renters in the community.
Very good. Other comments or questions or motion?
Yeah, back to the nonprofit. I think that makes sense to have to prove that. Otherwise, the wider community is subsidizing a group that may or may not be making much of a contribution to the wider community. So
absolutely.
And I am a fan of regular modest price increases. I think that especially in inflationary environment that we're operating in. I think that's important. So I would be glad to make a motion. That's if we're ready.
Sure.
I move to approve order number D 2022-080, adopting the revised fee schedule for Benton County Natural Areas, Parks and Events to be effective January 1, 2023.
Second.
All those in favor say aye.
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 Motion carries.
Thank you so much.
Thank you, Lynn. All right. Oh, and we do have something else on the third page. Look at that. I caught it this time. All right, 9.2, discussion and adoption of order D 2022-079, authorizing the payment of property taxes to certain municipalities or other taxing districts in advance for the tax year 2022-23 as authorized by ORS 311.392. And we have with us Debbie Bauer from Finance. Welcome.
Thanks. Thanks for having me. We do this every year when we take the small districts that would only get a certain portion each month, and so they're operating at us. It would be harder for them to operate if we did it throughout the year. So that's what we're asking on the small districts, to just pay them out instead of the ad valorem.
Thank you. Comments or questions, commissioners?
No, I'd be happy to make a motion.
Okay.
I move to approve order D 2022-079, authorizing the payment of property taxes to certain municipalities and other taxing districts as detailed in the attachment to the order.
Second.
Motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion carries.
Great, thank you very much.
Thank you. All right, let's see. It's not quite noon yet. Is there anything for the good of the order before we take a break and come back at noon? All right, in that case, we will recess and come back at noon.
Recording stopped.
Recording in progress.
All right, it is noon. So we are coming back for our public hearing. Tuesday, November 1st, 2022 at noon is the time set for the public hearing in the matter of amending the Benton County Development Code to include psilocybin regulations. All testimony, arguments, and evidence received during this public hearing must be directed toward the subject of the proposed code amendment. The hearing procedure will be as follows. 1, staff will present the staff report. 2, any member of the public wishing to present general testimony will be given the opportunity to speak for up to 3 minutes. Testimony from any representative of any other governmental body, and 4, the staff response. Please try to avoid repetition. If someone else has already expressed the same thoughts, it is perfectly acceptable to state that you agree with the statements of a previous speaker. If you have documents, maps, or letters that you wish to have considered by this body, they must be formally placed in the record of this proceeding. To do that, either before or after you speak, please submit the material to Erica Milo, who will make sure your evidence is properly taken care of. Finally, I will ask the board if any commissioner needs to declare any bias, conflict of interest, or ex parte contacts.
No.
And I have none. I saw a head shaking no from Commissioner Ojero. And with that, let's go with Greg Brett for the staff report.
Good afternoon, commissioners. Thank you. And my apologies for the mistake on the time of this hearing. I am used to them all being at noon from many years of experience, and lately they've all been 11 o'clock. So thank you for accommodating that. Members of the public, the Board of Commissioners held a work session this morning, went into quite a bit of discussion or detail about psilocybin and the proposed regulations. So commissioners, I won't repeat all of that detail. You're welcome. And but I will do a brief recap for members of the public who may not have tuned into the earlier discussion. So Benton County is considering an ordinance to amend the development code to establish local land use regulations regarding where psilocybin related businesses involved in the growing, processing, and treatment using psilocybin can be located. This needs to go into effect before the statewide program goes into effect at the beginning of January 2023. The Planning Commission held a public hearing on this matter November 18, received public testimony, deliberated, and forwarded a recommendation to the Board of Commissioners. A summary of that recommendation is on the slide on the screen here. It breaks the elements of psilocybin businesses into 3 main categories: growing, processing, and the treatment service centers. Growing and processing understandably may occur together or may occur separately. It's a rather industrial process as opposed to more of the traditional field crop and then processing that occurs in our farm zones in a lot of cases. In any event, in our code, they're broken into those 3 categories. In summary, growing or production of the fungus is allowed or would be allowed in our farm zones, and in our industrial zones, and prohibited in all other zones. Similarly, processing would be allowed in the farm zones and the industrial zones and prohibited in other zones. The treatment service centers would be allowable as a conditional use, meaning through a special land use review in commercial zones and at the airport industrial park. That's consistent with other similar types of land uses that are allowed in those zones. The service centers would be prohibited in other zones. The draft code or the proposed code includes a minimum separation distance between service centers and certain other types of land uses. Also limits on the hours of operation, which in the draft code are 8 a.m. to 10 p.m. and a prohibition on overnight accommodations unless those are separately allowed by the zone that the service center is located in, and those are allowed, overnight accommodations are allowed in some of our commercial zones, so that is a possibility. Also then to clarify that certain land uses are not allowed in conjunction with a psilocybin related business. The Board of Commissioners has before them an ordinance that if you conduct the first reading today, the second reading would take place 2 weeks from today, and then the ordinance would go into effect prior to the end of the year. I think I will stop my prepared remarks at this point and ask if you have any questions or any areas that you'd like me to go into in more detail.
Clarifying questions, commissioners? Nope, please proceed.
Thank you. All right, I think we can move then into public testimony.
Yes, so if you would like to testify and you are online, I see we have one person who would like to so far, but please put your name in the chat. And I will call on the room first to see if there's anyone who would like to testify in the room, and then move to online. Is there anyone in the boardroom who would like to testify? Seeing and hearing none, we will move online. I see that Jason Bradford would like to testify. Jason, if you would like to unmute yourself, you can have up to 3 minutes.
Okay, thank you. I appreciate this is a very complex subject, and there's a lot of implications for land use. And I know you're not voting on this today, and you're just taking input from the public. So I really appreciate the process is allowing us to think about this, because the planning commissioners really had to move quickly on it, and I don't think they had time to digest it as well as maybe they would have wanted to. What I would like to say is that from my background, I'm not a experienced psychologist or psychiatrist. I really came to this subject only in the last few years from kind of public, books and podcasts, and I became a little fascinated by it because of the history and the really compelling mental health benefits. So what I did to educate myself pretty intensively is went to a conference up in Portland for 4 days. And I learned a lot about what's going on in Oregon and what the potential is. And so what I want to sort of emphasize is a few things. One is that there's tremendous research that shows the benefits for a number of people with mental health problems that have seemed intractable. I think other people can talk about it well, but also that it can be done extremely safely in the way the Oregon is setting this up. Nothing is without potential harm, but the way this is structured is really responsible. And the state is doing an amazing job, the Oregon Health Authority. So I really trust that process. And I would really just encourage the Board of Commissioners to look at what the state is doing and be considerate of how much work they've already put into this, and how it's getting unrolled is really, really well. Both for the two things that are most important probably are the training for the people that are going to basically be the facilitators, as well as the service centers. And they're going to be done in a very responsible, professional way to limit any risk to the public and to the clientele as much as possible. So what I notice especially is that in the discussions at the state level, the real concern is about the number of service centers that are likely to be available to treat clients. And the way that this is drawn up for our county right now as a draft is limiting it in the county in ways that will make it extremely difficult to get many service centers in our county. So I would like to look at maybe expanding the allowable conditional use zones. And I know that there's sensitivity around doing this on the EFU or forest conservation. And I understand why. I think that there is a mindset or the predisposition to imagine that this would be in clinical settings, like in office settings, or in these sort of fancy retreat centers.
Jason, I'm sorry to
And-
interrupt you. That is 3 minutes. Could you wrap up, please?
Yeah, and I would say that there is a third way, a third path, which is to do very modest development that does not impact the commercial interests of having active farms. So I think there's a way to do this. It doesn't sort of take over farmland, make farmland overpriced, drive out commercial farming, but can do it in a way that actually brings people out into nature and allows them to connect to natural settings in ways that are very appropriate and helpful for their recovery. So that's the main thing I wanted to talk about. And
Thank you,
I
Jason.
appreciate your time.
Thank you so much. Next up, I see Dan. And Dan, if you'd like to unmute and let us know your full name, you have up to 3 minutes.
I will try to get this in 3 minutes if I at all can. My name is Dan Golitz. I am a resident of Benton County since 1994. A homeowner since 1998, and I've been a practicing psychologist in Corvallis for 25 years. I am very interested in the potential for psilocybin to improve mental health outcomes, and I'm very versed in the literature, and I consider myself to be, very knowledgeable. My wife, who is also a psychologist, we practice together. She has been the psychologist designated on the psilocybin advisory board for OHA. And so what I want to say is I've been following this program for several years. I'm very interested in being a part of it. I intend to become trained as a facilitator. I want to own a service center. I will probably do mine, in the city of Corvallis. And so, but I'm here also to support my my friends who want to set up service centers in Benton County. I think that having access to natural environments is something that very much enhances the experience for a lot of people. I understand that there are thorny issues involved here, and I'm not going to make any specific recommendations on how you do that, other than to say that I would really hope that you would find a way to make it feasible for service centers to be able to operate in locations that have access to beautiful natural areas. I did hear that time restrictions of 8 a.m. to 10 p.m. were mentioned a few minutes ago. I'd like to suggest that that's a bit too restrictive, because the way the program works is in many cases, people will need to be on site and supervised for 6 hours. If 10 p.m. was the limit, that means that we would have to start people by 4 p.m. I think that would have a downstream effect of limiting access by limiting, the amount of time available. And so I'd like to suggest that be expanded somewhat. And I mean, there's just so much I could say, but not much time to say it. I want to make myself available to you as you can continue your deliberations. And I consider myself to be very knowledgeable on these issues, and I will volunteer my time. I will come and talk to you. I will answer any questions that you have. I want to support this program and assure you that we intend to do it in a very responsible way that will benefit the public.
Thank you, Dan.
Mhm.
Is there anyone else who would like to provide public testimony? Hearing and seeing none. Is there any testimony from any representative of another governmental body? Hearing and seeing none. So we will close the public hearing and deliberate. We have a space on here for staff response if staff has any response they'd like to make.
Thank you. Just do want to clarify, Mr. Bradford mentioned the board not taking action. You are scheduled to consider a first reading of the ordinance. You can choose to postpone that, but again, we have a timeline, a deadline we have to meet by the end of the year. The other points I would mention is to Mr. Gollitz's point about hours of operation. I will note that it is, I don't believe we have hours of operation limits on other commercial uses in our commercial zones. So I just want to point that out, that this would be a unique limitation on this type of business. However, the overnight accommodations is something that is either allowed or not allowed in certain zones. So point that out for your consideration. Any other questions I can answer this
Any other
time?
questions before we move into more deliberations?
So I might ask a clarifying question. So you're saying that we could drop the hours of operation language from our draft code, but it would still prohibit overnight stays unless there was, oops, I'm getting the.
Gary Eyeball from.
As I understand it, we could drop the hours of operation from the proposed code, but we still would have the prohibition of overnight stays except in those zones where they are expressly allowed.
Correct.
So, there still would be some limitation in those rural areas, rural commercial areas.
Correct. Right.
So if we were to drop the hours of operation, would we have to then make a change to specify what overnight is defined as?
Right, sorry. In the proposed.
Come up here to the microphone, thank you.
In the proposed OARs from this at the state level, and they haven't been adopted yet, but in the proposed OARs, it's their time limit is 6 a.m. to midnight. So unless they decide to go forward with a different direction, they've proposed 6 a.m. to midnight as the hours of operation.
Thank you.
Thank you.
And so we could just either leave it silent and it would end up being 6 a.m. to midnight if that way, or stop it, or we could express the state 6 a.m. to midnight.
And then, sorry,
Yep,
I
I agree.
just saw that Suzanne Hoffman would like to chime in. Suzanne, please go ahead.
Thank you, Commissioner. I guess my request is that before final decisions are made, or if there's opportunity to be a part of further conversation, task forces, or whatever is laid out, that the health department have a more robust engagement in this conversation than it has had. I so appreciate Mara and Mac inserting themselves into this conversation in order to bring a health perspective. I don't think we've had the opportunity to have as robust a participation as the health department perhaps should. There's some questions and concerns we'd like the opportunity to work through, particularly with regard to service centers and treatment. And I think some of those are like comparisons to recreational cannabis and wine when this is not a recreational endeavor. It is a treatment. Treated like a medical clinic in some cases, and not in others per some of these recommendations. And I think we just need to have a greater understanding and perhaps bring some consultation and expertise and health equity lens to the conversation would be my request.
Thank you, Suzanne. Go ahead, Commissioner Odro.
I think in the perfect world, it would be wonderful to take more time. And perhaps we could use a task force or a working group after January 1st, but we need to have a regulatory framework when those OHA applications start going in January 1st or 2nd. And so I support the iterative approach that the community development staff has proposed, that we put these amendments to our code chapters 51 and 91 in place, and then see how it works and come back and start to address the issues, especially since we don't have all of the state OARs in place yet. So there is definitely going to continue to be change. I understand what Jason Radford and Dr. Goles were both talking about in terms of the desire to have more of a natural environment for the treatment experience. But I also heard what Greg Barrett was saying about the fact that it's likely that the state is going to have to take action in order to make that possible. So I am fine with taking a go slow approach, understanding that people want to make investments, but it's going to take a little bit of time to clarify the regulatory environment.
Thank you. Other comments or questions on Suzanne's topic or comment? Nope.
Just is our limitations here just a yes or no? And any changes would come after the first of the year?
No, you can make changes procedurally. Vance can clarify what needs to happen to do that, but you definitely can make changes.
So we would like make a motion to amend.
Actually, you could include your amendment in or
The
change
motion.
in the motion.
Okay, unless we have a whole
And
bunch.
that would then affect the change. We would make that change today, and the actual document would be available for public before the next meeting.
Okay. All right. Thank you, Suzanne. We appreciate your input and have heard your request. Let's see. Other comments or questions before we start deliberating? Okay, so it sounds like there's a couple of thoughts for us to talk about. One of them that I heard mentioned was the 1,000-foot separation from other facilities and whether or not the board wants to keep that.
I would be glad to strike that one. I don't think it. I don't see how it serves the overall goal.
I don't either, so I'm fine with striking that provision, especially given that the zoned areas where the service center is suitable are so small.
Okay, and I think Commissioner Ogier, you made a good point earlier about how the zones are so small anyway that, you know, is that even necessary? So, and again, as time goes on and we figure out what's working and not working, we can always, you know, reenact that. I would assume that anybody who would be closer than 1,000 feet would be grandfathered in. Yeah, okay, so I think we are in agreement for that one.
I would also propose that we eliminate the 8 a.m. to 10 p.m. hours of operation. And if anything, just shift to the 6 a.m. to midnight or stay silent and let the state prevail.
Okay, so I have a thought on that, which is, so number one, the city of Corvallis, you know, and the other cities will have their own rules or code on this. So it would just be in the rural areas. So I want to be considerate of any impacts that would be on kind of out in these rural areas, perhaps neighbors that aren't used to having traffic coming through at 6 a.m. or at midnight. I don't know if that needs to be a consideration. That just is something to think about.
In a rural area where you've got farming going on, there's going to be traffic at 6 a.m. And bigger and louder than a passenger vehicle. The midnight, again, I'm not drawing an analogy to a bar, Suzanne, but the bars are open until 2. So even in these small rural areas, I don't think that that's necessarily going to be a huge issue. Personally,
Okay,
And
thank you.
I think I would suggest dropping the time limit and wait for the state to work their magic and then so the rules are consistent. I think is always helpful. There's, to me, it seems like there's a lot of restrictions already in place, and if we can thin things out a little bit, I think that would make sense.
Okay. Thank you. So it sounds like we are good at striking the 8 to 10 p.m. time limit. Any other changes that anyone would like to make or propose?
Can I just get one clarification on your consensus on eliminating the 1,000-foot restriction? You're in agreement to remove that entirely, leaving the school prohibition to the state OARs.
Oh, yeah.
I believe,
Okay,
yeah.
so everything else.
There's more than just the 1,000 foot from, what we were talking about was the 1,000-foot distance between service centers. There, in the proposed ordinance as it's written, there's also 1,000-foot distance from any natural areas or parks and 1,000-foot distance from childcare. So those we have not addressed.
So you were only talking about it would be the proposed 91.686 subsection 2, subsection D as in dog, which is the 1,000-foot restriction from the psilocybin treatment center.
You have a packet page.
111.
111. Thank you.
That was my intent.
Could you repeat that, please?
So Commissioner Ogero's thought and suggestion was to remove only subsection D, which is capital D, which is psilocybin treatment centers, from proposed 91.686 subsection 2. It would leave in place the other uses that would be affected by this 1,000-foot restriction.
Perfect. Yes, that's makes sense to me. Any thoughts, Commissioner Malone? We're still trying to find it.
Well, on page 111 and
Middle of the page.
oh, okay.
And then the other change that we were talking about would drop on that same page in section 91.686 3 B, little b.
Right, okay. On the 1,000-foot, what part of this is coming from state regs?
Address that. So 2A, capital A, is from the state regulations. So separations from schools is from state regulations, and then B through D, licensed daycare, publicly owned park, etc., or another psilocybin treatment service center. That's all just locally proposed here at Benton County.
And
By the
those
planning
are put
commission?
forward- I'm sorry,
Yeah.
those are put forward by the planning commission.
Correct.
Is that what you just said?
Yes.
Yes.
Okay.
By the planning commission.
Okay. Other comments or questions, or do we want to try to make a motion?
I would be happy to make a motion.
Okay, please, and thank you.
I would move that we adopt ordinance number 2020, it's so hard to say, 2022 dash 0313 with a couple of changes to the proposed development code. And getting back to that page. Okay, That's
Got it, okay.
section 91.686. Dropping to big D. And striking 3 small b.
I'll second that.
Point of clarification, when we remove B, does that shift the other letters up automatically, just out of curiosity?
Yes.
Okay.
Yes.
All right, motion made and seconded. All those in favor say aye.
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 Motion carries. All right, good work, everyone. And just, as we've noted before, as time goes on and we are learning what works and what doesn't work, we have the option to make changes to our code. And I look forward to, if and when that happens, including our public health department and any other stakeholders, that would be good to have. Thank you.
Need to read the ordinance.
And is that you? Would you like to read the ordinance?
Yes, please.
Please do.
Before the Board of County Commissioners for the state of Oregon for the county of Benton, in the matter of amending Benton County Development Code regarding psilocybin, specifically chapters 51 and 91, ordinance number 2022-0313. Now therefore, the Board of County Commissioners of Benton County ordains as follows: short title, amendments to the Benton County Development Code regarding psilocybin. And this will come back for a second reading on November 15th under old business.
Thank you. And just one note, has that been publicly noticed? Are we publicly noticing it for 9 a.m. instead of 11 or noon?
It is not a public hearing. It just goes,
Okay.
it just is listed on the agenda.
So it does not need to be.
Nope.
No
No notice required.
Because I would like to have that meeting at 9 a.m. and not 11, since we'll be out of town. Very good. Anything else?
We need to make sure that these changes are put on the website, that this ordinance with these changes are put up on the website.
Will do.
Thank you.
And a general comment, and OHA has their limitations and regulations. I would encourage Benton County to go along with those. I mean, unless there's a good reason to have our own special rules.
Joe, as I also have a point of order.
Okay.
There is a chat that I'm not sure has been addressed.
Your mic must not be on.
What? Oh,
There is a subsequent chat that I'm not sure has been addressed by staff. I just want to point out that question came in.
what is the reasoning for the distance from parks?
That's correct.
And we close the public hearing, but Greg, would you like to?
So that's a recommendation that came from certain other jurisdictions. I think the rationale is in part public perception, concern about we don't know how these service centers are going to operate and what they're going to be like in our community. Let's just be cautious and just ensure that certain activities are kept distant from us.
I suspect it's the same as the rationale for distance from schools. It's a place where there are concentrations of children. And it may just be a perception issue, but there are concentrations of children in parks.
Yeah. I mean, it'll be good for us to keep track of moving forward, especially, the city of Corvallis, where some areas have more parks, than in other areas. Well, I guess that's the city of Corvallis code, not ours. So, yep. Okay.
We will have a natural experiment with different code in
Yes.
place in different places.
All right. Well, thank you very much, Greg, and
Thank you.
thank you, everyone, for your help on this. Is there anything else for the good of the order for this meeting? Seeing and hearing none, I will adjourn the meeting at 12:34. And we can all go eat lunch.
Thank you.